Namaste and greetings. I, Nikita Bhardwaj, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान, Nai Delhi, extend my warmest welcome to you all to IMPRI #Web Policy Learning. Today we mark the first day of the Law and Public Policy Youth Fellowship marks the first day of uh, Law and Public Policy Action Research Fieldwork Program, an online national monsoon school program, a 1-month online immersive action research fieldwork certificate training program. This program is organized by IMPRI, Impact and Policy Research Institute, New Delhi. The chair for the program is Professor Vibhuti Patel, visiting distinguished professor at IMPRI, and the fellowship lead advisor and expert legal hands-on session is Advocate Dr. Shalu Nigam, visiting senior fellow IMPRI. The distinguished experts include Shri Sandeep Chachra, Professor Vibhuti Patel, Advocate Dr. Shalu Nigam, Advocate Dr. Vaida Nayanar, Professor Mukul Ashar, Professor Uday Shankar, Shri Udit Mishra, Dr. Nivedita P. Harar, Shri Bhartendra Singh Baswan, Dr. Purnima Chauhan, Advocate Dr. Albertina Almeida, Dr. Gladstone Xavier, Professor Aruna Roy, Advocate Audrey de Mello, Dr. Kaustav K. Bandyopadhyay, Advocate Mrinalini Deshmukh, Professor Sharmila Ghoge, Advocate Flavia Agnes, Dr. Rashmi Singh, Mr. Debaditya Sinha, Professor Swaran Singh, Advocate Amar Jesani, Professor Anil K. Gupta, Justice Ajit K. Singh, Mr. Himanshu Shekhar, Dr. Amar Jesani, Dr. Soumyadip Chattopadhyay, Mr. Bilal Khan, Shri Rajiv Ranjan Singh, Shri Tikender Singh Panwar, Shri Shailesh Gandhi, Dr. Simi Mehta, Advocate Abdul Hafiz Gandhi, Professor Amita Singh, Dr. Ajay Gudavarti, Shri Amit Dubey, Professor Sanghamitra Acharya, Dr. Y. Suresh Reddy, Advocate Sanchita N, and Shri Surendranath Tripathi. The conveners for this course are Dr. Simi Mehta, CEO and Editorial Director at IMPRI, Advocate Dr. Shalu Nigam, Visiting Senior Fellow IMPRI, and Dr. Arjun Kumar, Director at IMPRI. I welcome you all to this enlightening deliberation and thank you for putting your time, energy, and efforts into truly understanding the vital role and complex intricacies of legal and public policy framework. This course would equip the participants with the skills and knowledge required to conduct meaningful action research. We have also shared the course outline and reading resources document in your email for your kind perusal. We will be providing videos of each session for flexible learning at your place and pace. Before we start today's session, I would like to announce the housekeeping rules. It is imperative that you join the meeting on time. There will be a Q&A session after each presentation. Share your questions in the Q&A box and not in the chat box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise. Refrain from making general comments in the question to save time. We have the following sessions for day 1 of Law and Public Policy Action Research Fieldwork Certificate Training Program. The first is Ethics in Research, Fieldwork and Action Research by Dr. Amar Jesani, and the second, Fieldwork and Quantitative Research Methods and Questionnaire by Dr. Soumyadip Chattopadhyay. To start this session, I would like to invite Professor Vibhuti Patel for her opening chair remarks.
Yeah. Thank you very much, Nikita, for inviting me. First of all, I would like to express my heartfelt thanks to the IMPRI team for making this. Why am I getting echo? Yeah. Hello.
Yeah. Ma'am, I think one of you will have to unmute yourself when the other one speaks.
Amar, unmute.
Yeah, go ahead, ma'am.
Hello. Thank you, Dr. Arjun Kumar, Dr. Simi Mehta, Dr. Shalu Nigam, Ms. Sweta Shankar, Ms. Swathita, Mr. Satyam Tripathi, Nikita Bharadwaj, for your hard work. And now we have so many participants for this action research course. Welcome to Dr. Amar Jesani, Dr. Soumyadip Chattopadhyay, and the esteemed participants. We all know that in the previous 5 weeks, we focused on understanding the nuances of public policies and the laws. And now we are entering into the action research part of it, that how are we going to create evidence-based data and understanding and analytical framework for conducting the research. So we had this little brainstorming session in which we also discussed among ourselves that how are we going to create participatory action tools for preparation, tool testing, pilot, stakeholders interviews, socially relevant local issues that can aid to the formation of socially useful policies and also legislation. What kind of research methodology we are going to use, what would be the ethical conduct in field research, in interviews, in focus group discussions, and also when we come out with the report, and what is the aim and goal of the research that we are doing in. Thus, we also understand that participatory research is a community-based method aimed at transforming status quo. It is a participatory as this research sees the respondent as stakeholders. They are not some subjects whom we are experimenting the way positivist research thinks. Participatory research, we all are the co-creator of knowledge, and it's a potentially empowering the community. The whole process of research also empowers the community. It places research tools in the hands of the research, like all the stakeholders, all the respondents, all those who are involved in the process of research. They all are equally involved in this knowledge construction. It minimizes the hierarchy between researchers and the research, so we don't go with an understanding that we are some experts who are going to research the community. We go with the humility to learn, and it is a two-way process of teaching and learning from the community, and community also learns in this whole process of research. It enables the community to identify their wants, their strengths, and initiate change with the support of researchers. Targeted community is involved in the identification of problem, in the planning and execution of the project. And also research can begin with consciousness raising discussions, identification of available resources to initiate change, and creating space for participation in the research, which is often cited as what is most important research on participatory development. So let us, in conclusion, like I would like to say that that aims of participatory action research is: one, to develop shared ownership of the research; number two, enable other participants to direct the research process and have a say on what to do and how to do; number three, create opportunities for collective data gathering and analysis; four, create space for participants to reflect on research and provide critical feedback. That means we have all those who are involved, they have a right to know what happened. So we have to make the research report accessible to them in the language they understand and in the medium they understand. If they are not able to read, then we can have a discussion with them. Build trust and non-threatening environment, which is extremely important in participatory research. And the last one is that to allow research to progress towards action and doing if desired by other participants. So we have to take them into confidence if they want to what kind of action that agenda that we have as a result of this research. And the most important aspect of is that ethical conduct, right from number one, like from starting the work till the end, we have to have ethical conduct, for which we have an expert, Dr. Amar Jesani, and we invite him to give his lecture. Yeah.
Thank you, ma'am. Next up, we have Dr. Amar Jesani, who will be taking up the session on the topic Ethics in Research, Fieldwork and Action Research. Dr. Amar Jesani is an independent researcher and teacher, bioethics and public health, and editor at Indian Journal of Medical Ethics. Welcome, sir, and over to you.
I have a little now. Okay. Morning to everybody, and thank you for having me here. Well, I am not a social scientist.
We can hear you, sir.
Yeah. You can hear. Okay. I'm not a social scientist. I come from medicine, and I carried some of my concerns in ethics from my original discipline. Social sciences were my acquired discipline because I did a lot of research using social science methodology. So that's how I am here to talk about both the ethics as well as different kind of social science research. This is a journal we published, which is a multidisciplinary journal, including social science, law, humanities, and of course medicine and public health. And so you'll find a lot of material which is dealing with the research in the field, as well as in the action research, particularly in the clinical trials and experimental research. You'll find a lot of material on this in this journal. What I'm going to do is because I think I have only half an hour, so I will have to take up everything very quickly. One is to look at what is the importance of ethics in research. Second is look at what is called research ethics framework. That what are the ethical concerns of different kinds in research, and how research can become ethical. Then the core of this thing here, the community-based and action participatory research. And the last is a little bit on research integrity. Let me start with saying that, you know, the relationship between policy and research is very complex. Sometimes, you know, in our naivety, we as researchers believe that when we come out with research findings, the policymakers are just there to grab them and convert them into policy. That doesn't happen. The policy making is a much complex and a dirty process. You know, it's like where all kind of other concerns go in addition to the evidence available on the ground. So keep that in mind. Second thing is that the policymakers are normally looking for evidence which can be generalized at the larger population level, because they want to have an impact of the policy either at the state level, district level, or the national level, whatever level that for which the policy is being made. So when we talk about community and a small community where we conduct the research and how far it can be generalized, that is very important issue for the policy maker. So there is a place for both quantitative research, which can be generalized at the population level, as well as the qualitative research, which can provide you nuances of what is happening at the community level and how various kind of policies will play out. So both has a place, but you must understand the context of each one. Otherwise, you may say that I carried out some good research in the community and why it is not flying at the national level. So there you'll have to have a complement of other support there. And the last thing, I think, even in the research evidence, there are various hierarchies, you know, like any other social hierarchies. Research has hierarchies. And they say that, well, experimental research has the most, I think, high level evidence it provides. Now, one can have a lot of debate about it, but then they say that, well, you shouldn't rely only on the experimental research finding, what we call clinical research, clinical trials, or experimental or community-based trials. There may be individual trials, which we call RCT, randomized control trial, or that can be community-based, where there may be cluster randomized trials. So all of them are very important evidences. But in last few decades, it is understood that even the experimental research findings are not sufficient. What you require is a kind of a synthesis of all kind of evidences available on a topic on which you want to frame a policy, either for the practice of the professionals or for the national level policy for the intervention. So that is what is called systematic review and meta-analysis of all kind of research, which may be experimental research, observational research, action research, all of them put together. So this is what research hierarchies and various kind of research methods are there, and how they play out in order to provide input to the policy. Let me start with the idea of what is the importance of research, or ethics in the research. Many people find that ethics may be a hindrance, it's a one kind of a bottleneck to be cleared, rather than taking it as a part or integral part of the research process. As you know, that science is absolutely essential in order to do research. If you do research without using any scientific method, it won't fly. Nobody will publish it. Nobody will acknowledge it. And so the research remains on paper. And in the process, you have exposed many people to the research risks. So method of science is important. The same way, the ethics are important. Because when we do research and we go and get carried away in our research process, there is always a possibility of harming the society, harming the participant, the community, and all. So in such a situation, it is very important that the ethics are taken care of at every time, every level. It's not just physically harming somebody, but you are taking information, information going into the public where the individuals are getting identified. They can suffer physically, psychologically, legally. So it's very important. In professional practice, ethics are very important in order to protect, like say in medicine, patient. In other professions, the clients and the customers, they all of them, where ethics plays a kind of a mediation role. In research ethics, it is for providing protection to the study participant. Integrity is also part of the research, and that provides the protection to the scientific process, that the scientific process is not vitiated at any level. Like in society, research is a microcosm of a larger society where there are different kind of power relationships. So you have an institution or an organization that you belong to, from where you carry out research. Your ultimate aim is to reach out to the participants, community, individuals, or collective, and involve them in the research in order to create data and evidence. But in order to do that, you require staff, you require a lot of input. So there is a need for money. So there comes funders, sponsors. Sometimes the institution itself may be funder, the intramural study, what we call. And when you try to go to the participant, there may be gatekeeper. You go to the village and there may be panchayat members and say, well, we'll not allow you to do research here. And it has happened to us, at least to me. And when I'm doing research in the community, the panchayat say, well, we are doing research on, say, abortion. And panchayat say, well, here all the women are very good. Nobody undergoes abortion. We will not allow you to do it. We had to go to another village to do it because there is no way we can actually get access. You want to study patients in the hospital, you have to go through the hindrance of meeting the director and getting permission. They are all gatekeepers. How to negotiate with the gatekeeper also raises a lot of ethical problems. Because gatekeeper may say that, well, what did the people in my institution, in my village, told you about what I'm doing? Will you please tell me that you're going to share it and violate the confidentiality of the participant? So there are issues here. So there are 4 different kind of parties. There can be multiple in between. Okay, there are a lot of researcher and institution use contract research organization or the organizations which will do data collection for you, or organizations which will do data analysis for you, laboratory work for you, all kind of stuff. So for that also, you may have many other actors created. Their relationship actually brings about a lot of ethical tension. And most of the ethics guideline in research that you will read is about the relationship between these 4 parties, or more than 4 parties. And how that relationship should be governed is a part of the entire ethic discourse. The law fits into this because some of those guidelines become law. So if you have research-related laws in India, then you will find that some of this guidance that is given in ethics is converted into law because society considers it very, very important. In India, only in health research, some guidelines of ethics are converted into law. for the non-health research, at the moment, there is no legal binding that there should be certain ethical processes, except little bit that is coming from UGC now, University Grant Commission, that is more on the integrity of the research, where plagiarism is looked at as a big issue. What are the various ethical aspects of the research? There are four. There are 8 major benchmarks that we call in the research, which qualifies any piece of research, whether it is observational, action, any one of them. Whether you are using quantitative research, qualitative research, all of them, this is a common general framework. 8 major components of it, or benchmarks of it. One is social value, scientific validity, favorable risk-benefit ratio, fair selection of study population, informed consent, respect for participants and communities, confidentiality issue, independent review and collaborative partnership. Social value says that when you are doing academic research, you must do it for the goodness of the society. It must have social value. Now, what social value will be considered to be appropriate and what social value which will not be considered to be appropriate can undergo different interpretation at different times in the society. But you will have to argue out that in which way it will improve science, it will improve society's well-being, particularly the well-being of the people who are deprived in the society. Scientific validity is another one. As I was telling you that if your research is not using scientific method or scientific, broad methodology, then there will be a problem in the sense that it will not be recognized as a good piece of research, and it will be waste of time and energy. Sorry. The third is a favorable risk-benefit ratio. You have to estimate that your intervention and research, even just going there and collecting data in a survey, is an intervention to on the individual or to the larger group. It is not an it is a kind of interaction which can change the research context. The kind of information that you collect may be explosive. If it is given out in public with the name of the people who provided it, it can harm them. So you have to find out when you design a research, who will benefit from the research, and what will be the harms to the participant. There are different kinds of harms. It's not just physical harm that we are talking about. There can be psychological harm, there can be social harm, economic, legal harm to the dignity of people feeling being used. You have an institution and you have an area where you keep doing research. And people ask that, well, every year, number of students come, collect data from our area. There's no improvement in our life. Are we being used as an instrument? They don't like it. It's a violation of dignity. Yeah, when you collect something, you have some responsibility for them to do something for them. So it is very, very important to look up, risk and benefit, and ensure that the benefits are outweighing the risk. In an observational research, oftentimes there is no benefit for the participant. They are non-beneficial research. In order to create benefit, what they do is that, and that is how we started in ethics in early 1980s, was that after you finish research, go back to the participant and the community. Tell them what you found. Inform them, give them in writing in an appropriate manner without violating anybody's confidentiality. Let them use it with their politician who represent them, their panchayat members, their municipal corporation or municipality members, and try to fight for their right. It's very important. The fourth is the fair selection of study participants. We often keep doing research on those people who give information. There is a lot of discussion going on about the statistical system India has. And one of the things that is being debated is that rich people don't provide you data in surveys, right? Only poor provide. So you keep studying poor. That's the problem. You have to study both. You have to see that those who create poverty are also studied. Otherwise, you will have only one side of the data. So you have to find ways of improving that and see that as far as possible, cross-section of people are brought into the study. Of course, though, there are studies which are focused on the one section of the population where you don't have to do it. But even in that section, you must do the selection in a fair manner. Informed consent is very important. Taking information from people, you must ask them permission for it. Consent is very, very important. There can be differences in documentation, how the consent will be documented. Even a doctor, when you go to the doctor and doctor wants to examine your pulse, doctor has to say that, well, I want to hold your hand and want to examine your pulse, palpate the pulse. He has to ask you and take permission. She has to ask you and take permission. It cannot be taken for granted because you came to my clinic, you have given implied consent. No. It cannot be taken for granted that the person allows you to enter his or her hut or house. That means that person has given implied consent to talk with you. No, on this side. In India, we are very hospitable people. We normally don't have to give them money to give you information. They will give you a cup of tea. They say, Atithi Deva Bhava. I have gone so many places and enjoyed tea without sugar and without milk given by the poor participants to me. I didn't have to give them anything. They just respect you. And it's very, very important that we also should be respecting them. So we have to ensure that they are participating voluntarily. The disclosure of the information about what research you are doing is done adequately, and we try to find out that they have understood it. And then document, whether it should be signed one or it should be a verbal one, the consent. All of this thing can be negotiated with your ethics committee, but consent is definitely required. After they give you information, you still have a lot of obligation. Ensure that the things are kept confidential. Tell them from the very beginning that the level of confidentiality that you will provide will be of certain kind. If you tell them that you are going to provide absolute confidentiality, that is under no circumstances, identifiable information will be given to anybody, neither to the police nor to the even judge of the court, nobody. You will face consequences, but not here. If that is what you are saying, that absolute confidentiality, then you have to stand by it. Otherwise, in the informed consent, in the written consent form that you give to them, please make it very clear that the confidentiality is subject to law. Okay, so level of that. When you are putting data out, you must see that no data at the micro level are given in such a manner that there is an indirect possibility of the identification of the participant. So it's very, very important here. The researching risky and illegal situation, you may have to give an absolute confidentiality. And for that, you may have to link up with the government to provide you permission to give absolute confidentiality so that you are not prosecuted later on for getting data from you about illegal activities. Research ethics committees are important. As of now, they are proposed in Indian law for the health research. But still, many non-health researchers, social science researchers, do take consultation with the ethics committee in order to ensure that their research is ethical. But it is consultative. In health, it is regulatory. If you are doing health research and you have an institutional health ethics committee which is required as per the law, then it must have a registration with the health research department of the Ministry of Health. If you are doing clinical trial with drugs, then same health ethics committee requires registration with the Drug Controller Journal of India. So there is a legal regulation. The law and ethics, overlap quite a lot. And there you have to use ICMR's 2017 guideline in order to review and approve the ethics proposal. That last one is called collaborative partnerships. Institutions collaborate, funder and institution collaborate. That should be based on equity and non-exploitation. That's how when you do review of research and ethics committee, you also ask for agreement signed by the institution with the funder or the sponsor, or the researchers are signing agreement. Those copies must be examined to ensure that the powerful sponsors and funders are not exploiting institutions, right, or our country in general. Very, very important there. You have to see that there is enough funding for creating capacity, strengthening of the institutional researchers who are from your institution in the collaboration with the powerful people, so that there is a further development of research capacity as a part of the research that is being supported. And also something about how the post-research benefits to the participant will be provided. Now, coming to the action and the participatory research, what are the additional challenges? What I have done is I have selected 4 papers. I think a couple of them I sent them to you for reading, but there are 2 others. There are 4 papers which outline general tenure of what kind of ethical challenges that you will find. This is a paper which talks about participatory bioethics research and its social impact. It says that if you make research participatory, I think Vibhuti was talking about it, the participatory research, then you reduce the coercion in the process of taking care of your patient, particularly in psychiatry. And that is the whole case study that they have explained. So what comes out of it? Action research is a cyclical process where you plan research, you go into action, you learn from the action, and again plan for the research. That means with every research action step, you learn from action and you improve your action there. And that way you try to change the community or whichever group that you are working with as a part of the action research. Participatory research is where the members of the community are also made part of the research team. So they are not just separate from you, they are also part of you. So you become not an outside observer, but you will become inside observer. Is a part of that. They participate in designing research. They participate in the interpretation of the finding, that the action you have taken and what are the interpretation of that action. And they may also contribute in writing. If they can't write themselves, they can at least go through what you have written and tell you that this is what you have missed out and review the entire stuff. So participatory research is considered to be ethically the best because it bridges the gap between subject and object, where researcher and the participants are not 2 different entities, but they are merged into one and they jointly work. Now, most of the participatory research at the community level, particularly when it is done with the disadvantaged group, can create a lot of conflict. with the people who are very privileged in the community. And so they have a lot of political implications. And this has been, I think, there in the literature quite a lot, that if you embark on participatory action research, and if your political action becomes, conflictual, then you must stand by the community that you work with. If there is a backlash against them, you cannot run away. You come from the urban area, you are in the institution, you have a very secure job. You cannot put people at risk as a part of your research and then run away saying that, well, they did it, I didn't do it. Action was there. Action was yours also, because it was, you had facilitated the whole action. Very, very important ethical issue, your obligation. On the other hand, the earlier paper that I was talking about, the psychiatry, paper, where they try to reduce the conflict by using participatory action research. That means they were able to not only have a mental health patient as participant, but this provider who were coercing them, they were also participants. And they created a framework in which there was a dialogue between all of them. Now that led to reduction of the conflict. So if you go in an area where there is a conflict, there are different hierarchies, and if you are able to bring them together and reduce the conflict, then also the participatory action research works there. Both of them have good ethical implication. In one, there is a big security implication. In another, you may find that there is a reduction of the conflict. But at the same time, it may also have a potential to co-opt the oppressor into the system of the oppressor. That also you need to keep it in mind. So you have to be very, very reflective when you enter into this kind of relationship. The second is a paper is about what is happening today are very large projects which are going beyond the boundary of health and into the social and other fields. So it is talking about agriculture, nutrition, health research. Once upon a time, agriculture research was siloed into one. A nutrition research will be done by nutritionists, and the health research will be done by the public health and clinician. This is bringing all them together. What is the use of talking nutrition if you don't look at the agriculture where the food comes out? The food brings the nutrition. And what is the use of talking about nutrition if it doesn't produce good health benefits? Bringing all of them together. So there are large such projects going on. They are all action research, they are intervention research. And in such a complex situation where you are having agriculturists, when you are having consumers, and you are having health professionals or health workers, you need to create various spaces for deliberation among them, which is in research is a very, very challenging concept. Oftentimes researchers just sit in their air-conditioned offices in the institution. The lower level, the contracted staff who go there. Very important that they all participate. It is getting some kind of what they call the conversion spaces for the researchers of three different professions: agriculture, nutrition, and health, as well as all of them having their conversation with the participants in the community. I think this is very important. So what they do is that they embed certain specialized ethics people inside the project who create this conversation among various stakeholders. The third one I picked up from the feminist research methodology. I'm sure some of you may be interested in it. We have a look at this as an open access paper. I'll circulate my PowerPoint, so you don't have to write down just now. So you can have a look at this paper. This says that this is like participatory action research. that in participatory action, the feminist methodology believes strongly, committed strongly in that, and say that there should be epistemic justice in the sense that knowledge is not the monopoly of few middle class intellectuals, but it is for everybody. And so when you do research, for knowledge, bring everybody. Everybody should gain equal knowledge from the research. Epistemic trust. We should trust and respect each other's worldviews. And then the outcome of research should be co-authored by everybody. And in order to do that, they said that you should have what is called research responsibility agreement, in order to ensure that the relationship between researchers and the community of the people with whom they are doing research is having a basis of reciprocity. That is very important. That you formally sit together and say that what is each one's role, reflect on it, and what is each one's responsibility, and how each one will be accountable. Normally researchers have very little accountability to the participants. Here, the participants can also make researchers accountable. So creating that kind of relationship is one approach in the action and participatory research that comes from the feminist literature. You can have more on this, either reading the paper, and there may be a lot of related similar papers. This is the last in this one, which is about being mindful of staff. We do a lot of things about researchers and participants. We forget that there is in between, there are a lot of staff members. What happens to them? Much of the work of data collection is not carried out by single researcher. Single researcher is involved only when you are doing PhD or student research. Large projects are normally with a lot of research staff, where the top person is the faculty with a secure job. The rest of them are all contracted researchers who go and collect data under the supervision of the top person. So caring for staff is often missed in the ethics discussion. We should bring it in the ethics discussion everywhere. Staff collecting data in the field face ethical challenges, even in consequences like psychological and emotional disturbances and the physical threats. They are repository of data. They have to carry data to you, and they come under the threat because there may be some sensitive information there. Look at the domestic violence research. Now, somebody is telling you about stories which are of physical violence, and that can also affect the participant, the staff who is collecting information. Participant also, staff can also get involved in the emotional breakdown of the person who is giving information. How do you support them and ensure that they remain, normal through the entire process and learn and grow as a part of the research process? The other problem the staff faces is the precarious employment condition. Employ them for 6 months, collect data, and then they are thrown out. The remuneration and living expenses are bad. The main researcher, when he or she goes, finds good accommodation in hotels and goes around in car or jeep, while these people are either using public transport or they are using infrequent support from the vehicles. Intellectual exploitation. They collect data, give them to you, and sometimes their names are not mentioned even anywhere. Feeling of guilt and shame that they are going around and collecting data from the poor people, and at the end, the poor people may not benefit anything. So I'm taking something from them but giving them nothing. That is a feeling of shame that they get. That should be also the feeling of shame for the researcher. But they are sometimes quite away from the actual data collector. Disparities between staff researchers and the study population. This is another thing. the employment and income disparity. So you have to bring the issues of protection, job security, institutional support structure for them, bringing their concerns in the methodological and ethics review. This is what is required as a part of your ethics framework. Two last slide, and then we can have a discussion. As I was telling you that the integrity of science needs to be protected. And for that, you have to ensure that there is no misconduct. You must have heard about data falsification and fabrication. People just make up data rather than actually going to people and collecting them. That's where you have to guard against. And when you look at the data, you have to have some way of identifying fabrication. And that's also why in many research fields, the replication of this study is becoming one very important issue. That when you replicate a study, the data comes out are totally different. And then there is a question raised about the original study. In relation to analysis, data falsification, the way statistical methods are wrongly, inappropriately applied and all. And in publication, all of you know about plagiarism, the junior researchers not getting authorships and that kind of stuff, or something that is done by junior researcher is appropriated by the senior researchers without giving any credit. So all these are a kind of misconduct which violates the integrity of the science. This is last. You collected data. Do you have responsibility to share the data with the larger community of researchers and others? Why it should be done? People give this data free of charge to you. They do it as a part of altruistic conduct, saying that yes, for something good of the society, I should be parting with the information. Isn't it a public good? And if it is a public good, how can few researchers or the sponsor say that this is our trade secret and we will not give it to anybody? What is required is that data should be anonymizable. That means you must ensure that the individual who has given data, their names are not identifiable directly or indirectly. And if anonymization is possible, then data should be made available in the public domain so that other people can look at it. It also gives you higher credibility to your research. Anybody else can do the same analysis as you did and come to the same conclusion, or can bring nuances that you might have missed out, right? And that way it gives higher credibility to the research. And at the same time, by sharing data, those who are doing fraud in research, they are eliminated. They gradually take backseat. And there is a public scrutiny. There is accountability of the research. In journal, many times editors ask for data, reviewers ask for data. But the most important thing is that the reader should have data availability with data which are anonymized and can be put in the public domain. Keep it in mind that some of the qualitative data may not be possible to anonymize. And so it may not be given out in the public domain, but they can be shared with certain select researchers, with the same commitment that they will keep the confidentiality of the information, signing that kind of agreement. So that way, it is not only data of yours, but the data of the larger research community who are having qualification to do similar kind of research. So data sharing is very important. It's a part of the ethical requirement. So I think I have covered almost everything, perhaps more than what I was asked for. So hopefully you will find it useful. And if you have questions, you can have them now, or you can always send me by email and we can have discussion.
Thank you so much, sir, for your enlightening insights. Your expertise in the field of ethics and research has truly broadened our understanding in this area. Now I request the chair, Professor Vibhuti, ma'am, to share her remarks.
Medical anthropological research. My major question is the current debate on metadata and how the social media is violating laws of privacy. Can you just explain the procedural dimension and what kind of legal action which different nation states have taken?
Well, I think there are countries which have come out with data protection laws. I think that is very, very important. I think the European data protection law is one of the most stringent as far as I know. I remember recently I was in a consultation group with a larger international project. And some of the researchers from a country wanted to get the email ID of the researchers of the other country. And they said, well, we cannot share it unless those researchers give us permission. In India, we would have just given them without even, batting our eyelid, right? So that kind of protection is very, very important. Now, big data are the data that we inadvertently, as a part of using social media or any other public-based activity, put up in the public domain. Now, there is a discussion that can this kind of data can be provided protection, confidentiality protection. And that's where I think the Indian data protection law, I believe it has already been passed by the cabinet. So once it comes out, these issues will be debated.
It's a bill. It's a bill, not passed. Bill.
Yeah, it's a bill. It's a bill. Yeah. So it's a proposed thing. Now it will go to the parliament and there will be debate, and I hope there will be very stringent public debate. And who will be the one who will do the protection? That is also very, very important. So we'll have to keep that in mind and see how it goes. But yes, we need to have this protection. Otherwise, with the new technology of artificial intelligence, everybody's data can be, even your emails are continuously monitored. And then something that you say out in a casually to your friend can be misinterpreted and used against you. And so all those things are possible given the technology available. So there has to be some very, very strong data protection necessary.
Thank you.
Thank you, sir. I request Advocate Dr. Shalu Nigam to share her remarks.
So it's a very wonderful and very comprehensive presentation. We have learned a lot about the ethics and the research, how to go about it. But just one thing, as a young researcher, when I'm going out to the field, how should I maintain the neutrality? Like basically they say that the researcher should be neutral, but with all the social media and other things now, we all have some or the other kind of opinion about any issue, like through WhatsApp, through television, get formulating opinions. So how should I maintain the neutrality in such kind of the polarized world?
Well, it is difficult, but when you enter the field, I think the most important part is how you interact with the community. Like any other professional relationship, the relationship of trust that is to be established is I think is a paramount thing. And relationship of trust comes by your respect for them. So I find it sometimes very difficult to envisage a researcher who is highly biased against certain communities, right? In personal life, in social media, and everywhere, and is doing research with that particular community, and how that person can really get the trust of the community to tell them, and that's where real test comes, because the professional ethics, which make you neutral, which make you secular, which ensures that every individual's rights should be respected, right? If that is not in your personal ethics, and your social ethics, it creates a huge, a split. And this split is really problematic, because it was believed earlier in peacetime, when there were no strong polarization of the society, that one can have one's own personal beliefs, but it will not be carried in the professional domain. So I, as a researcher or as a doctor, when I'm there, any community person coming there, I'm going to, whether the poor person comes, whether minority comes, whether a tribal comes or a Dalit comes, I am going to behave in the same manner, right? But to a certain extent, they were able to do it, but not all the time, because the prejudice gets expressed not just just by talking about it. It's in your body language, in the way you mix with the people. And particularly as a researcher, when I go to the community, and I have faced it, that if we go and live in the Dalit community overnight, and the next day we go to the say Brahmin Pada, in the same village, the Brahmins will be looking at us differently. And if we live with the Brahmin, where we are culturally more attuned, and the food we get is much better, because it is of our liking, because we come from similar background, then when you go to the Dalit will not talk to you. The information you gather from them will get affected. The quality of research gets affected. They see you as a part of the privileged strata there. So we started doing living in villages, in the public spaces like school, which is empty at night, and we get permission to sleep there, or a panchayat office or something like that, or get if it is going to be a field work for say more than say 7-8 days, then get something on rent in a neutral place, so that there is acceptance from all the communities there. It's also important to have really high quality data, and you have to have that commitment. So it is a science commitment as well as commitment to the community, to see that everybody in the community will be respected by you, and you'll be carrying them together. It's a difficult task, particularly people are having very strong prejudicial viewpoints in of their own. To be different in culture is not a problem, but to be tolerant to other culture is a major problem. So you'll find that people say that, well, I have a culturally different, but when you go to a different culture and they are eating differently, different kind of food, different ways of eating, and you feel if you feel intolerant to that, then people immediately notice, right? They don't allow you to enter beyond a point in the house because you come from a different background. Particularly within researchers, there are upper caste researchers, there are lower caste researchers. And the lower caste researchers do tell you that when I went to a certain upper caste household, they won't allow me to sit inside. I had to take all the information from the window or from the small, hall in the main gate of the house. They won't, directly talk. They will not give me even a glass of water. Or if they give, there is a separate one kept for them. So all those things that you'll find there. Otherwise, you have to deceive them. You have to see that because you are educated, you make a pretense that you are like them, upper caste, But at the same time, when you go to the lower caste people, it is an asset, that person, So it's a very challenging task, and it has a implication both for ethics as well as the quality of data that you collect. Yes, Radha Kumari.
Yeah, namaste, sir, and thank you so much. Hello.
Yeah, I can hear you.
Sir, आपने एक बात कही कि absolute confidentiality maintain करने के लिए we need to take permission from the authorities. It could be any authority. For example, if I want to research in a town, and I know that town that where people take money for vote, I know for sure. But if I want to gather data from that constituency, then do I need to take permission from that municipality first? Second, why would that municipality authorities would grant me that permission? Because I know the person who are elected there, they themselves are elected on the basis of that bribe. Third, if I maintain, if for any research, if I maintain absolute confidentiality, then how my research data is verified, how it is authenticated. Like it could be a fabricated data or it could be an authentic data. Thank you.
Well, I think this is a very important question. There are certain research areas, like as you said, that corruption is one. There may be people who are taking narcotics, right? In health, we have encountered quite a lot, and in HIV/AIDS research, that also came a big way, because when narcotic addicts share needles with each other, the HIV is transmitted. So when you are doing a study on gangsters, how are you going to do study on the gangsters, right? So the point is, when you are doing research, unlike an investigative journalist, your job is not to expose a particular individual, but to study a particular phenomenon. You are trying to study the phenomenon of corruption. You are not trying to find out what are the 5 people who are corrupt in the municipal corporation. Okay. So that is the difference. You must keep it in mind. But if you are doing, say, a journalistic job, then you have to expose the ones who are corrupt directly, right? So this is a totally different ball game here. Here you are trying to understand what is the phenomenon of corruption, why it is taking place. Is it because of the bureaucrats, because of the politicians, because politicians are coming from certain background or making certain promises in election? You are going to create a theory about how the corruption works at the local government level, right? Now, in that case, you do not require to give out the names, right? But what happens, like say during your corruption, I can give you one example which happened in Canada, where a PhD student was doing research on the narcotic addicts, and she went to the areas where the narcotics were exchanging needles. During the process of during the time when she was in the community and doing this research, a murder took place. Okay, it's very common because these are addicts. They are also the supplier of narcotics there. That means the gangsters are involved.
Yeah.
Right. So all kind of things are happening there, and she comes out. She writes her thesis, and when that murder is there, an investigation is taking place. They're not able to find who murdered. So the police goes to the judge and says that, well, this woman was there and she has interviewed everybody, including the person who got murdered was interviewed by her. And she has also interviewed the suppliers of various narcotics. Ask her to give data along with the names of each person.
Okay.
She said that, well, I am not going to give you a name because in this community, nobody would have talked to me. If I told them that the police asked, I'll give you names. Right? You go to the corrupt person and say that, well, if you are doing corruption, will you talk to me? Unless you give that person absolute confidentiality, saying that your name will never come out. I want to understand how exactly you people are doing. Some of them, out of say 100 corrupt people, 10 will talk to you. That is how you collect data, right? Here she said, I will not give. University refused to support her because there was a case against her saying that if you don't give data, you are doing contempt of the court and you will be put in jail. Right? Ethics committee, which agreed to this project proposal, refused to support her. In Canada, to fight a case like this, you require a lot of money,
Hmm.
right? She had to fight on her own. Ultimately, she won,
Hmm.
saying that there are certain fiduciary relationship of trust that cannot be built unless certain kind of confidentiality is provided, and research is not possible if confidentiality is not given, right? So that's how in the developed countries a trend emerged that before you go there, try to go to certain departments which are designated for getting permission, saying that I am going in this kind of community and trying to do this research. I am not going to reveal names, and provide me security for that. And legal security is provided. In India, concept is still not there. And that's why you will find that most of the research in corruption is more theoretical and based on secondary data. There is not enough material that researchers themselves have brought out.
Hmm.
And we rely on media reports rather than we ourselves going and collecting data,
Hmm.
right? All those kind of things you'll find. And the last thing is that you asked me that how, if names are not made public, how
Yeah.
these data are authenticated.
Yeah.
Madam, the names are never made public, even
Yeah.
in NHF data, in
Exactly.
NSS data.
Hmm.
Names are never, they are always protected. That is what is the identifiable information. And that's how the research takes place in a larger framework of a system,
Hmm.
which is academic, where
Hmm.
there are various levels of monitoring there. And if I find that you might have fudged the data, I have to prove it.
Hmm. Hmm.
Data fudging is considered to be a big crime, against
Yeah.
science.
Hmm.
So if you publish a paper in my journal with a fudged data, and somebody from here say that, well, she has fudged data and proves it, I have to retract your paper and have to inform the head of your institution saying that you had fudged the data.
Hmm.
The other way, as I was telling you, was that replication of your data. If another researcher tries to do the similar study using your methodology and say that something is wrong in what she came out with, I did the research, same methodology, I'm finding different things,
Hmm.
right? So that's how the researchers get accountable. There is no direct accountability where somebody comes and watches on you,
Hmm.
or every name is given in the public domain and other people go and try to find out.
Not in the public domain. At least you keep it with you, and if there is some.
Yeah, of course it is with you. What I'm saying is that the confidentiality is a data that you are having, which are identifiable.
Okay.
And you are not going to put them in public except the numbers which are come out of it,
Yeah.
or any narration that comes out of, but they are totally anonymized.
Okay.
Right? So that people cannot come to know that which person who has said what.
Yeah.
I remember I was doing a study. Government of Maharashtra asked me to study 3 different rural health centers. So I went and I did anthropological work in 3 different rural health. I spent 3 months at each. When I started writing report, I immediately realized that I made a big ethical blunder. Because whatever way I was writing, it was very easy to find out for the government of Maharashtra when they read report that in which health center I am talking about. That means my observations of what was happening will implicate large number of health workers, the auxiliary nurses, the doctors and all. So I had to go back to the health secretary and say that I took the project from you for three centers. I can't give you a report unless you give me another 25 centers. Allow me to randomly select another 25 and collect data, not for the anthropological work of three months each, but going there, staying for 1 week and making certain key observations. And then when we put together the entire stuff, it was for the 28 health centers. And so the government cannot find out what I'm describing is coming from which center. So that the people who really cooperated with me with a good faith in me, saying that they will give us authentic information, but I will not betray them. Because the aim of the research is to improve the rural health system as such, is not to go and do manager's job, to find out who is not working properly.
Hmm.
Okay, I find out who is not working properly, but it is a research finding,
Yeah.
and I try to make a generalization based on it, which government can use in a policy making in order to improve all the research, all the health centers, right? That is the whole idea. So you may have to see that different tactics are used in order to provide privacy rights to the people. Confidentiality is nothing but respecting other people's privacy rights.
Yeah.
Right. So that is what I was saying. That's where your points are extremely important. And sometimes while doing research, we forget about them and then regret. And fortunately, the health secretary was so good that he provided me more sample in order to camouflage the data. But if health secretary has changed and health secretary was very antagonistic, then he might not have allowed me. He said, I gave you money for 3 centers. Give me qualitative report, and I want to take action against those people. But I survived, and that way actually respected my participants who trusted me. So yes,
Sir,
it is a very challenging sometimes in the field.
your examples are very illuminating. Actually, they are very helpful.
Thank you. Thank
Examples. So one more thing. Which authority you consider here that the appropriate authority where I should go to?
Well, I don't know about corruption, but in the health normally, when this work on narcotic addicts and all was done, that was done at that time. There was a National AIDS Control Authority, and there used to be AIDS societies at the state level. So it's working out an arrangement there. Many researchers said this taking permission is not legally necessary.
Okay.
Taking permission is to protect yourself.
Yeah.
That tomorrow, if judge
Example
says
of Canada.
judge says that reveal data, then you say that you cannot ask me because government gave me permission to not to reveal it. But there are people who have taken risk, done research, given complete anonymity, and nobody has gone to the court to make them do it. Same way in journalism, the journalist can say that I will not reveal the source of information. That is their ethical obligation to the source. Suppose I tell something to the journalist and say that, well, don't give my name. It is job of the journalist. And tomorrow a judge asks this person, a journalist, tell me who said this. And he can or she can refuse to give the information. She may go to the court, go to the jail, but she will not. Simply because that is what is required. I'm sorry, I run out of time long back, but there are questions which are anyway. Thank you very much, Radha.
Thank you, sir. Thank you so much.
Very nice questions. Yes, Nikita.
Thank you so much, sir, for enlightening our gathering today. Now we would like to move to the next session. I would like to invite Dr. Soumyadip Chattopadhyay, who will be taking a session on the topic Fieldwork and Quantitative Research Methods and Questionnaire. Dr. Soumyadip Chattopadhyay is the Associate Professor in Economics at Vibhuti Shantiniketan and Visiting Senior Fellow at IMPRI. Welcome, sir, and over to you.
Am I clearly audible to all of you?
Yes, sir.
Greetings from Shantiniketan, and very good afternoon to all the participants and all the distinguished panelists, Professor Patel, Dr. Jesani, and Dr. Nigam. So let me first share my screen.
That we are seeing.
Yeah, so this one. So is it okay?
Perfect.
Okay. So as it is quite also evident from our previous speakers, very illuminating talk, that social science research is basically a tool to understand and predict the human behavior, and the findings of research that contribute to policymaking and facilitate academic deliberations. But for this, we rely on the information provided by the target population chosen for any particular analysis. And there are two crucial aspects related to this. One is how to determine the target or sample population. Now, this is the part of the discussion of sampling design. And the second one is what information needs to be collected. And this is related to the questionnaire construction. Now, regarding the questionnaire construction, now, this is a very crucial and important part of the research. Now, one obvious reason is that if your questionnaire is inappropriate, then definitely you are very likely to get the responses which are not true or partially true. And then it will mislead the researchers, the academician, and the policymakers. And another important aspect is that it is very difficult to think of any the guideline for designing the questionnaire. And because of the because of the very simple reason that the human behavior is one of the most unpredictable matters in the world. People with same social setting, with same level of income, same level of education, they might respond differently to any particular situation. And that is why, as a researcher, we had to note down a lengthy list of do's and don'ts based on the experience of the other researchers, and then use them as that guideline. Now, there are many seen and unseen events, unseen issues which guide this behavior and the differential results which are observed. Now, researchers need to collect information on such issues. Now, the analysis, the outcome, the general conclusion, the policy recommendation, the identified areas of future research, all of them, they depend on how perfectly the questionnaire is constructed. So in today's presentation, my focus will be basically on two aspects. One is to discuss the attributes of a well-designed questionnaire, and second is to understand the framework for developing questionnaire. Now, being a student of economics, mostly I'll draw on the examples which are mostly related to the economic issues. But I think the core idea of the core challenges of designing a questionnaire, I think, will be much more clearer to you after my presentation. I'll try to help you on that. So these are the, now to start with, while doing the development research, so these are the basic three objectives. First, we have to have a problem statement, like specifying the absolute goal of our research. And although this is very simplistic, but the thing is that as a like when we teach in our university, like when the students come to us for doing some research, then we see that they have some very not the objective itself is not very well defined. So it is very important for any researchers to identify precisely the objective goal of the research, and that should be based on the availability of data. And here also it is very important to understand the finer differences between the research problem and research hypothesis. And broadly, by research hypothesis, we mean is that aspect of the theory which is to be tested for empirical validity. And for that, we draw on the data which are qualitative in nature or the data which are quantitative in nature. Now, let me give one example. Now, suppose as a researcher, we are interested to determine whether or not an employer is discriminating against a given group of employees, say women. Now, here, discrimination occurs in both these two cases. You see, now one is when both women and men, they are equally qualified, but women are paid less. And in the second case, women, they are equally paid as the men, but women are more qualified. So in the previous case, we are actually capturing this discrimination, this idea of discrimination through the difference in the salary, whereas in the second case, we are actually trying to capture the idea of discrimination via this qualification aspect. So accordingly, like the way you are actually devising your research objective, so that is very crucial, the questions that are going to be the part of your questionnaire. So that is why it is very important to specify the research hypothesis as well as the research problem as well as the research hypothesis. Then we have to decide on the methods. And here within that methods, my today's presentation is basically is centering on, that is basically the app that it is related to the aspect of surveying. And then you have to analyze those results, you have to interpret the results, and then you have to have some kind of discussion or conclusion and implication. This is basically the broad aspects which we follow while doing the development research. Now, regarding the survey methodology, as we know that the survey methodology is nothing but the study of sampling the individuals. We sample them in those individuals or those units from population, and here we make some kind of statistical inferences. Now, for that, there are various statistical theories that there, various econometric techniques are there, but we generally rely on statistical inference to study or to have some idea about the sample based on the population. And when we are dealing with a survey can refer to many different types or techniques of observation, but in the context of survey sampling, it mostly involves a question. And also, as we know nowadays, that surveys are conducted in numerous research fields. These are the fields, and survey, it elicits different kinds of information. And also, survey sampling is the process of selecting a sample of elements from a target population. Now, regarding the selection of sample, now we have to be very careful about certain aspects. So let me just quickly go through those aspects. One is the representativeness of the population. Now, representativeness of the population is very important because of the reason that we are actually trying to understand our sample characteristics based on the population characteristics. So obviously, if your sample is not representative of your population, then whatever policy conclusions or whatever analysis which you are going to make, they are most likely to be erroneous in nature. That is why it is very much important to ensure the representativeness of a sample. Let me just give you a very simple example. Suppose you are interested to say determine the relationship between gratitude and job satisfaction of a group of biologists. Okay, now definitely your sample might be say 30-40 individuals who are working as the biologist, and for that you can consider the population of a particular region or population of a particular state for as the population. Okay, now there are many ways to evaluate this kind of representative, to ensure this kind of representativeness. You can ensure representativeness via gender, you can ensure representativeness via age, or say socioeconomic status, profession, education, and so on and so forth. For example, if you know that in most of the biologists in the population are women, and if your sample is all about male, then definitely you are not going to have a very good representativeness of the sample. So that way you have to think of certain ways to ensure the representativeness of the population, and there are various sampling techniques which can ensure that, well, the sample with which you are working, they are representative of the population. Then another serious problem which we need to be very much careful about is the non-response bias. Okay, now non-response bias, obviously, in many cases we often find non-response biases from the case of urban population. Okay, so this is a very serious problem. And also there is another problem which is a case of coverage bias. That means the sampling frame does not include all the population elements, and the observed values, which should be the case, that the observed values deviates from the population parameters due to difference in covered and non-covered elements. And that is why we need to be very much careful about the first problem, that means the representativeness of the population. And apart from that, I think my previous speaker, Dr. Jesani, beautifully mentioned about the issue of accountability. Now, in many cases, the bias also arises due to the negligence on the part of the investigators or the researchers in asking questions, in recording the responses. So here we need to understand the importance of getting or the importance of obtaining the accurate information which is basically very much important for ensuring the success of any research problem. Now, while doing the samples, there are different samples which we can consider. One is called probability sample, which is one very simple probability sample is the simple random sampling, where each element of a population have equal chance of being selected in the sample. And apart from that, we have also some non-probability samples. For example, we can do or we can resort to the purposive sampling, where we are actually where we may choose our sample in a very much purposive fashion. And then we have the case of stratified sampling, so where we can stratify our entire population into different strata in order to ensure the representativeness, and then we can select the sample observations from each of those strata. So that is basically another one example of stratified sampling. And apart from that, we may also think of a kind of systematic sampling. For example, you may say if you are going to a village and in the absence of any proper sampling frame, you may decide to sample every 10th households from that particular village after starting from a specific or central village points. Okay, so that is basically one very crude example of systematic sampling technique. Now, coming to the choice of survey mode. Now, there are the choice of survey mode, as it is quite clear that it is defined by research objective, research budget, survey type, target population, and so on and so forth. And these are the different survey mode with which we generally work. Now, among these different survey modes, generally the group interview and the personal interview, they are used much more extensively as compared to the other modes of interviewing. Although in the recent, especially after this COVID-19, the other modes of interviewing have become much more useful for our research purpose, but still we rely much more on the personal interview or the group interview. Now here, the general rule is that more sensitive or personal the information is, the more personal the form of data collection should be. So this is the guiding part of our choice for as far as the choice of survey mode is concerned. Now, regarding the survey mode effect, we have to be very much careful about another bias, which is causing some kind of distortion in the result. One is the social desirability bias. Social desirability bias is generally likely to be higher in the case of telephone or face-to-face interview. But here, by social desirability bias, what generally is meant is meant is that as a when we go to when we do some kind of survey, sample survey, then for the respondent there is a tendency to underreport the socially undesirable undesirable attitude and behavior, and to overreport more socially desirable attributes. For example, if you consider the case of, say, the political party choice, okay, or say the issues related to the mental health, or say issues related to the sexual behavior. So in those cases, this kind of social desirability bias is very frequently observed by the field investigators. But whether this will be a problem needs to be assessed within the context of the survey content and the research objective. Now, regarding the questionnaire designing, let me now come to the other part of the my presentation. That means the aspects which we need to consider while designing the question. Now, questionnaire designing, as I have already mentioned, is a very crucial stage in the survey research process because of the simple reason that a survey is only as good as the questions asked. And the problem is that the questionnaire design has no theoretical base to guide the researcher. So it is generally said that the questionnaire design is more of an art than a science. And so as far as the design of questionnaire is concerned, now it will depend specifically on whether the researcher, they are interested to collect exploratory information, or they are interested to collect the information which is quantitative in nature. Now, there are by exploratory information, that means we are actually interested in collecting the qualitative information for the purpose of better understanding or the generation of hypothesis on a subject. And as far as the quantitative information, generally these are collected to test some specific hypotheses which have previously been generated. Okay, and just let me give you one example of this kind of exploratory questionnaire where it might be much more preferred over the formal questionnaire. For example, you are interested to interview the female head of the households to find out how the decisions are made within the family when purchasing the daily essentials. So obviously, in this case, instead of some kind of structured questionnaire, it will be much more useful if some exploratory questionnaire are used, because here a form, if as an investigator, if I use a formal questionnaire, then what will happen is that it might restrict the discussion and prevent a full exploitation of the women's views and processes. So in this case, exploratory questionnaire preferred more over the formal questionnaire. And in this context, this distinction between structured questionnaire, unstructured questionnaire, and quasi-structured questionnaire are very much important. So I'll be coming to these structured, unstructured, and quasi-structured after 2 or 3 slides. But before going into that, those details, let me just point out some of the features of well-designed questionnaire, because as I have already mentioned, that given the same task and the same research hypothesis, different people will probably come up with different responses and which differ in terms of their choice of question, in terms of their line or the sequence of questioning, in terms of their length of the questionnaire. So there are no hard and fast rules about how to design a questionnaire, but there are a number of points which we can remember. First one is, you have to be very much, this is very obvious, that you have to, your questionnaire should meet the research objective. Okay, but actually this is obvious, but sometimes they do not adequately probe the particular issues. Now, again, at the same time, this is not unusual, because every survey is bound to leave some question unanswered. In fact, this will give you the idea or the scope for doing some future research. But our objective while designing a particular question is to minimize this kind of problems. Second is, it should be you have to devise a questionnaire in such a way that it should obtain the most complete and accurate information as far as possible. The questionnaire design needs to ensure that the respondents fully understand the question, because that is very crucial, because based on the questions the respondent will answer. So, and they are not and they are less likely to refuse the answer, they are less likely to lie to the interviewer, and they are less likely to conceal their attitudes. So a good questionnaire is organized and it encourages the respondents to provide accurate information, to provide unbiased information, and to provide complete information. And third feature, which is very much important, or which is very much important for designing a good questionnaire, is that a well-designed questionnaire should make it easy for the respondents to give the necessary information, and also for the interviewer to record those responses. Okay, because there are 2 groups. One is the interviewer, another is the respondent. So it would be easy for the respondents to respond, and also for the interviewer to record the responses, because on the basis of the record, we are going to analyze those responses. And finally, it is very important to keep the interview brief and to the point, and be so arranged that the respondents remain interested into the whole process of this questionnaire. Now, these are the different steps which generally we follow while doing or while designing a questionnaire. First, definitely, we start with the initial consideration. Then we decide on the question content, phrasing, and response format. Then we decide on the question sequence and layout. Then we may decide on doing some sort of pre-testing, which is known as piloting, and then accordingly we can do the revision, and then we end up with the final questionnaire. I am going to going into the details of all these steps in my next slides. Now, as I mentioned, first you have to define the target respondents, then you have to choose the method of reaching your target respondent. That means you have to decide on the sampling scheme or the sampling frame. After that, while finalizing or not finalizing, while designing your questionnaire, these are the different aspects which one should keep in mind. One is, what should be asked? How would questions be phrased? I'll give examples of all these things, because how they are going to be crucial in our design of questionnaire. In what sequence should the questions be arranged? What survey layout will best serve the research objectives? How should the survey be pre-tested, and does the survey need to be revised? And it is definitely, if we follow this kind of thing, then it will be helpful for making the necessary adjustment for administrative aspects of the study. For example, we may decide on the length of the time, we may decide on the appropriateness of the time of the survey. For example, in many times when as a researcher, when we go to the field, then we see that many of the respondents, they are not there to respond. Okay, so for example, this is the classic case, like when you are doing a survey on studying the agricultural situation, it is always advisable to avoid farm visit or visit to the farmers during the busy harvesting period. So these are some of the issues which we need to keep in mind. And these are the different components, standard components. If I have time, I'll show you one of my survey schedule, a questionnaire schedule. But these are the different specific components of a survey schedule. It should have some information stream, framing questions, specific questions, demographics, and then the typical thank you message. Now, coming to the question of what should be asked. Now, if we consider what should be asked, now this questions, the answer to this question of what should be asked, it should be based on two basic considerations. One is the aspects of survey relevance. That means all information collected, they should address to up specific research questions. And second is helping the decision maker in solving the current problem. So this is basically related to the survey relevancy. And then the next aspect, which is very much important for deciding on what should be asked, is the survey accuracy. That means we intend to increase the reliability and validity of the respondent information, and the surveys should be simple, understandable, it should be unbiased, unambiguous, it should facilitate and recall and motivate the respondents to cooperate, and proper question wording and sequencing to avoid the confusion and the biased answers. Now, regarding what should be asked, let me, this distinction is very much important from the perspective of the challenges which as a researcher we face while designing the questionnaire. One is the aspect of this distinction between between fact and opinion. Now, this is basically one example of factual question. For example, we may ask that, has anyone of age 16 to 14 from your home gone outside for working? That means as a child level. Okay. Now here the answer is either yes or no, because this is a factual question. And this is an example of close-ended question. Okay, I'll come to the details of close-ended question. But if you consider another question which is related to this question only, that this is an example of contingency, which in the literature is known as the contingency question. That means depending on the answer to this factual question, as a researcher, you may be interested to ask this particular question, that if it is so, is it very common in this community that a boy or girl of age 6 to 14 go out for work for earning? Okay. Now, obviously, here you cannot give answer either yes or no format. Okay. So here one possible alternative to use Likert scaling format format. Okay. So here you may think of these different options and then record the respondents' responses to this particular question. So this is known as the contingent question. Now, obviously, if you just look at the responses, then it is quite clear that these are basically related to the opinion of the respondent. Whereas the answer of the respondent to the first question is basically the fact, where the responses to the second question, which is generally known as the contingency question, it is basically a kind of opinion in nature. So therefore, while designing the question, you should keep in mind this distinction between facts and opinion. And now come to the different types of questions which generally we put in the questionnaire. Okay, now there are three different choices, three different options which we have. One is open-ended response question, another is the close-ended response question, and the third one is the open response option, also which I will discuss. Okay, now when we are considering the open-ended question. Now, definitely this open-ended question, they pose some problem, and they ask the respondents to answer in their own words. Okay. Now, this is basically generally these are generally turning out to be unstructured in nature, because and since it is unstructured, it is very much important for the researcher to record the responses of the respondents verbatim, and so that the problems of analyzing the data in the post-data collection period can be avoided or can be minimized. Okay, so what are the advantages of this open-ended question? Now, these are the specific advantages of using open-ended question, because these are most beneficial for exploratory research, especially when the range of responses is not known. I have already given one such example. It also may reveal many unanticipated reactions to the towards the questions or towards the product. For example, they often reveal the issues which are most important to the respondents, and at the same time, they may reveal also additional information which initially at the start of our research work we didn't thought of. Okay, so that is another advantage of doing using this open-ended kind of question. And these are the good first questions because they allow the respondents to warm up, because in many cases we design a questionnaire in such a way that it consists of both open-ended questions and the closed-ended questions. Okay. And another distinct advantage is that the respondents, they can qualify their answers to emphasize the strength of their opinion. But there are lots of other disadvantages as well. For example, one specific disadvantage is that it has the high cost of administering open-ended question, and the possibility that interviewer bias will influence the response. For example, my previous speaker talked about the issues related to domestic violence. So, and how the interviewer own perception will actually influence the respondents' responses. Respondents may find also difficult to articulate their responses. Respondents may not give full answer because they may forget to mention some of the important points. Okay, and also another important challenge is basically the data collected, I think, is in the form of, as I mentioned, is in the form of verbatim comments. So it has to be coded and reduced to some sort of manageable categories, which is indeed a huge task. And these are some of the examples of open-ended question. For example, what things do you like most about your study, or what comes to your mind when you look at this advertisement? Okay, or for example, another question like, when did you purchase your tractor? Okay, so there are different options which, again, just although this is not a kind of specific idea of open-ended question, but this is a open-ended, open response question. Okay, so which I will come to the later part. Now, regarding the close-ended question, now in this close-ended questions, these are the questions in which the respondents, they actually are given with some specific options which are limited in nature. Okay, and so that means they are actually provided with some alternative responses, and they are asked to choose one among the one, or in some cases maybe multiple among those alternatives based on their standpoint. Now, obviously, there are certain advantages of this kind of closed interview. For example, it requires less interviewer skills, because in this case, since you are already specifying the alternative responses and also specifically mentioning the different responses, so it is easier for the interviewer to also to record the responses, and also to do some it is easier for the interviewer or the researcher to process those responses. And it takes less time to answer. Definitely, it is easier for the respondents to answer. It provides comparability of answers, because when you keep your question open-ended, then definitely there are lots of aspects of subjectivity or objectivity. But here, since the options are specified, it will actually provide some sort of comparability to the answers. Although the application of whether your or the situation or the context where your closed-ended questions or the open-ended questions are more specific, are more desirable, that will be basically dependent on your research problems or the research hypothesis. Okay, and responses can also be classified, making analysis very straightforward. And it has disadvantage in the form of it actually lacks the range in the response alternative, because you are initially specifying some of the alternatives, so you may not end up with some specific viewpoints. Although in general, for example, when we do this kind of closed-ended questionnaire, then we always keep one option others, okay, apart from the different specific alternatives. So that can capture this kind of, or this is one way through which we can actually minimize these disadvantages which are associated with closed-ended questionnaire. But definitely one of the biggest disadvantage of closed-ended questionnaire is that it lacks the range in response alternative, and also it actually prompts the respondents to choose the most convenient alternative. So that is another disadvantage. Now, this is another example of structured and closed-ended questionnaire. So, for example, as a researcher, suppose you are interested to know whether the food grain production is sufficient to feed your family for the whole year. So obviously you have three specific choices rather. Four specific choices. One is yes, no, do not know, and not share. And then the second question, that means here it is it is kept as C10, which is known as the contingency question. That means the respondent is being asked, like, if he or she is considering the food grain production to be insufficient, then for how many months can his or her cereal or food grain production feed his or her family? Now that can be 1 month, 2 months, 3 months, and so on and so forth. Okay, so this is one question. But again, you may add another question. We may add, and so what is the question? Question is, in case of food shortage, how do you manage for survival? Now there are two options. One, you can keep these questions open-ended, or you can also if you know some of the response, or if you have some prior research experiences, then definitely you can also specify some of the alternatives to make the answer to this particular question close-ended. So that means, depending on your research, you have to decide on whether to use questions which are close-ended in nature, or the questions which are open-ended in nature. But definitely this is an example. This is now obviously we may think of many such examples, but this is one specific example where we may think of both the two types of questions which we can utilize in our research. And apart from that, there are many other questions. For example, there is simple dichotomy questions. Like this is basically the apart from the close-ended questions and the open-ended questions. The questions in these the questionnaires, there are different types of questions which we generally see in our questionnaire. One is simple dichotomy question. That means the choice of one or two alternatives in simple yes/no format. The determinant choice questions, for example, the choice may be one among from multiple alternatives, and another may be a type of frequency determination question. For example, as a researcher, you may be interested to know, say, the responsiveness of the elected representatives. Okay, so in that case, one indicator may be how often your elected representative visit your places or visit your locality. Okay, so your answer may be fortnightly, monthly, 6 monthly, or yearly, or never. Okay, so that means you are actually always, often, occasionally, or never. That means you are actually this is an example of frequency determination question. And then also there is attitude rating questions. Now these are most widely used, for example, in satisfaction surveys. For example, as a public policy maker, you may be interested to know whether the respondent is satisfied with the state of, say, the state of water supply delivery in his or her region. Okay, so that means how satisfied he or she is with the delivery of the water supply in his or her region. So here, definitely there are many options. For example, it may be highly dissatisfied, neutral, satisfied, highly satisfied. Okay, so this is basically a kind of attitude rating questions. And apart from that, there may be some sort of questions which are in the literature generally known as the checklist questions. So it actually allows the respondents to provide multiple answers to a single questions. For example, this is specifically one such examples of checklist question. For example, when you are trying to make a decision on what products to buy in the supermarket, these are the different aspects of that product which you need to consider, and depending on this, there are multiple options which you can think of. Okay, so this is one example, and the final one is the open response option. Open response option is basically eliminate some of the disadvantages of both the open-ended and closed-ended questions, and it includes both open-ended and includes some specific response as well. One specific example is, suppose what features of this product do you like? Okay, so this is an open-ended question, because here we may ask the respondent to express their opinion depending on these 5 dimensions. Okay, or so here that means here we are actually allowing to the respondents to express their opinion regarding these 5 dimensions. So in a sense, we are actually specifying the response options, but at the same time, we are making them open-ended. So advantage is avoid the, obviously there are certain advantages of these open response options question, which is one is the avoid the potential problem of poor memory or poor articulation by the respondents, because for example, just in the previous example, it may happen like if you just ask the respondent like what features of this product do you like, then and if you do not prompt him these 5 dimensions, then it may happen that he may mention performance, quality, but he may forget to mention the weight, which may be crucial for understanding the feature of this particular project, so the particular product. So in that sense, this kind of questioning format, it actually avoids the potential problem of poor memory or poor articulation by the respondents. And also, it recording during the interview is turning out to be relatively straightforward. However, the major disadvantage with this particular problem is that it requires the researcher to have a good prior knowledge of the subject in order to generate the likely response options before printing the questionnaire. Now, as I mentioned, or it is quite understandable that there are going to be situations in which the questionnaires will need to incorporate all the 3 forms of questions, because some forms are more appropriate for seeking some particular forms of responses. But there is a general guideline which we may follow in order to decide whether we want to keep our questionnaire close-ended or open-ended. For example, in cases where it is felt that the respondent needs assistance to articulate their answers, to express their answers, and the preferred dimensions are already determined by the researchers, then definitely close-ended questions, they are much more beneficial. But open-ended questions should be used when the options, the options to the questions, they are very large number. There are a very different large number of possible alternatives, and when the researcher himself or herself is unsure about the likely responses. So in that case, I think it is better to keep the questions which are open-ended in nature. Now coming to the aspect of sequencing. Now this sequencing part is also very much important for designing the questionnaire. Okay. Now one definitely that the respondents for example, what are the opening questions? For example, you as a researcher, we should not put such questions as opening questions which put general strain on the memory, or say straightforwardly, the first question shouldn't be the case that what is your annual family income. Okay, so this is very much important, and actually that is why the flow of the question, the variety of the question is very much important. And also we need to minimize the order bias, because this is bias caused by the influence of earlier question in a questionnaire or by your answers position in a set of answers. So we need to think of a questionnaire, creating a questionnaire in such a way so that we can minimize this kind of order bias. In fact, there are certain techniques which we generally follow in order to ensure proper sequencing of the questions. One is in the literature is known as say funnel technique. For example, you want to know how much money is spent on say health related matters in Delhi. So it is better to start with some general questions like where do you live, what do you come from, where do you work, how much do you want, and then you can ask how do you spend the health. Because when you ask this kind of questions, or you approach the research problem in such a way, then it will give you some additional information which will be helpful for you to analyze the pattern and trend and determinants of the health expenditures or the other crucial issues which are affecting the health expenditure of a particular locality. So that is why this kind of funnel technique, filtering technique, or pivot question technique is very much important. And this is another important aspect which we should keep in mind. For example, it is good practice to keep the questions as simple as possible. Okay, and we have to avoid complexity. The simpler the questions, better would be the responses, better would be the chance of getting the responses. And also, it is always advisable to avoid the questions which are leading and loaded. For example, you just consider this particular question. Do you like the speed and reliability of your car? So obviously here your answer could be yes or no. Okay, but when you phrase your question in this way, then definitely there are two different aspects which are interlinked, or which are actually there in this particular question. One is the aspect of speed and another is the aspect of reliability. But when the respondent is answering only in yes/no format, then it is not possible for us, the researcher, to understand whether his yes answer is related to speed or yes answer is related to reliability. Because it may happen that the the respondents, he may like the speed, but he may not very much, or he may not like the reliability aspect. Okay, so that is an example. Like, it is always avoid the leading and loaded questions. Also, it is basically very much important to avoid or to minimize the ambiguity or ambiguous term. For example, if you just consider this particular example, like, do you regularly service your tractor or do you regularly service your car? Now, this word regularly is very important, because to some regularly means weekly, to some regularly means monthly, to some regularly means say 6 monthly or a year. Okay, so you have to, if you want to get proper answer to this particular kind of question, then it is always better to avoid this kind of ambiguous term. And even if you to avoid this kind of ambiguous term. Another aspect is, what is your income? Now, obviously, if when the respondent will give answer, then definitely there can be many responses in different dimensions. For example, it can be hourly pay, it can be weekly pay, it can be yearly pay, it can be income before tax, it can be income after tax, it can be income in kind as well as in cash, or it can be income for the respondent himself, or it can be himself or herself, or it can be income for the family as a whole. Okay, so if this is the case, so definitely while specifying this kind of question, or while using this kind of question, you have to keep this. These are the issues which we need to keep in mind while framing this kind of question. Also, it is better to avoid double negative items, avoid making assumptions, avoid burdensome questions that may tax the respondents heavily. For example, one such example is, 4 years ago, was there a shortage of labor? So definitely this kind of question doesn't make any sense. So this is just to give you some examples. Okay, and finally, this is basically the aspects of pre-testing a questionnaire. So after deciding on the wording of the question, on the method of the survey, on the sequencing of the questions and all these things, we may come up with a draft questionnaire. Now, there is a practice of pre-testing that questionnaire, because and why this is important, because it is very much useful. Generally, a small number of respondents are selected for the pre-test, and the purpose of the pre-testing the questionnaire is to determine whether the questions which are worded will achieve the desired result. That means whether you are actually getting the results at all or not, or whether the questions which you are which you actually have put in the questionnaire, they are confusing in nature or not.
Are you able to hear us, Soumyadip sir?
We are not able to hear him, no?
Yeah, I think sir's internet got stuck.
Actually, it's raining heavily here.
In Mumbai? Oh,
Well, extremely heavy.
I'll just check this.
From it's raining heavily in Mumbai, and so like Delhi is also whole
I
waterlogged.
know, correct. Full of water everywhere. Today it's the torrential rain. Yeah. Participants are there. They are. He's speaking from Shantiniketan, no? Professor Soumyadip is speaking from Shantiniketan.
Yes, Kolkata.
Because even there, the weather forecast is showing that even Bengal is going to be affected with heavy rains. I think yes, covered, 95% yes, covered. This was the last slide, so piloting was the last, yeah. So I think we have got completed. Radha Kumar. Can we have a schedule for the day? Yes, hello. Which schedule do you wanted? Hello, Radha Kumari ji. Can you unmute and speak?
Ma'am, she can't unmute herself.
Acha, acha. But what is she talking about? Schedule for the day?
Ma'am,
Today you want to start your fieldwork?
yeah, good afternoon.
Yes, ma'am.
मैं शेड्यूल जो हमें मिला है ऑर्गेनाइजेशन से वो 11:30 it will start on particular days, but we do not have that schedule that how long it would continue and where we would have intervals. That's what I want, because so that I can plan my day.
Oh, that means 11:30
Like
to 1:30.
for today, I do not know
Ah.
how long it would continue, how many sessions do I have for this day, when I would have interval. So because I have so many other tasks to manage.
Understand. Yeah, yeah. Okay. That is, yeah. Today is your first day, that's why you're asking.
Yeah, ma'am. Yeah.
I understand. I think the schedule will be shared, yeah, immediately.
Yeah. Okay.
Dr. Arjun Kumar, would you like to explain?
Ma'am, Soumyadip sir is on phone. He's not able to connect, but sir can
Yeah.
go on for the phone.
Yes, so now Madam Radha Kumari has asked a question. Today it
हम
is.
उस पे आ जाएंगे.
Yeah,
Soumyadip complete कर लेते हैं.
ठीक है.
Soumyadip sir, go ahead.
Well, I think I was just at the last slide of my slide of my presentation. Yes, the piloting the question. Yeah, that was the slide.
Yeah.
So what I was arguing is that after deciding on the mode of the questions and all these things, we need to do a kind of piloting using a small number of respondents. And these are basically used for big testing. And the purpose is just to check whether the questions which we have kept in the questionnaire, so whether they are worded properly, whether the questions are confusing or not, whether the questions are placed in the better in a proper sequence, and whether the questions are properly understood by the respondents or not, because it all depends on the respondent responses that we are going to analyze. Okay, so this kind of wording, sequencing, and the kind of responses that we are going to get corresponding to a particular questionnaire is very much crucial for doing this kind of piloting, because once we do this piloting exercise, then definitely it will be easier for us to ask some additional questions which may be relevant, or we may delete some of the questions which may not add, or which may create confusion or some sort of other problem. Okay, so that is why it is basically another important component of questionnaire design is to this kind of piloting the question. Okay, so that was the last slide which I wanted to draw your attention. So that's all. I'm really sorry for this internet connection. Actually, I'm in Confidentiality, so you is not.
Everywhere, I think it's a
really sorry for that.
rain. No, everywhere there is no problem. Yeah. Thank you, sir.
Thank you, sir.
I think I'm not also not getting proper clearly here, all of you. So I think there is one question that you mentioned, ma'am.
Yes, please go ahead, sir.
Okay. So could you just please mention the question once again?
No, that question is to the organizer. It is about the schedule, because today it is their first day. So they wanted to know the schedule for this whole month and different sections. So it was about that, yeah.
Okay.
If we have any questions from Soumyadip sir, we can take that.
Yeah. So I have one question is about.
Since there is a problem, ma'am, may I request all the participants, if they have any questions, to mail me that question, since I'm having some internet problem.
Sure.
If it is
Just
possible,
write your email ID in the chat
get
box.
me the question, I'll get back to them.
Yes, definitely.
If it works.
Yeah.
Sure.
Fine.
Okay.
Dr. Soumyadip, Vibhuti ma'am has a question for you. Would you like to take that?
Yeah. I just one question is that during the pandemic of 2 years, rapid assessment surveys were used by both the local self-government body and the union government to come up with the answers to the challenges which the pandemic had posed. So how do you see the utility of rapid assessment surveys, and what are the processes involved? Because some are field-based, some are they were interviewed on WhatsApp, they were interviewed on various social media platforms and all. So I just want you to throw light on rapid assessment surveys for the developmental intervention.
Sumang, thank you for this very important question. So yes, rapid assessment surveys, they are very crucial, and especially during the pandemic period, they definitely helped a lot in shaping our development intervention. For example, in IMPRI also, we did some of the rapid assessment kind of surveys via over phone and over internet also to understand the basic problems which were faced by the city, especially the urban poor. So the city makers, we use this particular term, city maker. So in a sense, this kind of surveys are very much useful for developmental intervention. But at the same time, the thing is that the basic quality of the survey depends on the very crucially depends on the questions that we are asking. Okay, and at the same time, we need to keep in mind regarding the ethical issues, the commitment-related issues. I think I was just listening to Dr. Jesani's lecture, so he mentioned about a very crucial point, like commitment to the research and commitment to the community. Okay, so this is very much important for making truly effective this kind of rapid assessment survey. So these issues are properly taken care of. The designing of the question and this kind of issues, if they are properly taken care of, then I think these are going to be very much crucial for understanding both the challenges of development interventions and what we could do to improve or to make certain policies which are going to be really, really effective.
Thank you, Dr.
Thank you.
Really enlightening. Yeah. And good for us for refreshing our thing on research methodology and research methods.
Thank you, ma'am. Thank you so much.
Thank you, Soumyadip sir. Have a nice day.
Yeah.
I'll mail you the questions if we get any.
Should we move to the closing remarks then?
Yeah.
No, we will have some discussion on the topics as well. And
also they want to know the schedule, no? Yeah.
Yes, Sare queries.
Yeah.
Many participants have given very good topics. Vibhuti, you can remove the screen for now.
Yeah.
And we can, those who will raise hand, please allow them to speak, Vibhuti. For example, Dikshita has chosen a topic she's just sent on public transport, emerging issues in public transport, a case study of Ranchi. Very good topics. If any of the participants have any questions, they can raise hand regarding their topic. If they want to share and take suggestions from our panelists, they can do that. I'll go to Prof. Patel and Dr. Nigam to give some more insights into that. But before that, I will just answer the very good query of Radhaji. Ma'am is asking about the schedule. There are 2 sessions on the research method we just had, and there are 2 sessions next Monday morning. One is by Prof. Patel, another by Dr. Mehta. They will be telling you about research writing and editorial thing. Prof. Patel, being an economist, will also touch upon methods and other issues when you are in advanced stage by next week. Other than that, Dr. Nigam would be taking interactive sessions for fieldwork along with our research team. That we will keep on updating. There is one session tomorrow wherein we can interact and have more discussion upon the same. As we go further, we will also have small cohorts. Samriddhi will reach out to all of you regarding topics. Our other researchers will also reach out to you. We'll have subsequent sessions planned as and when required for the whole group, but also individually we'll get in touch. So you don't have to worry, just frame your questions. Time is of essence, so please plan accordingly. Now I invite Prof. Patel to give some more remarks about topic selection and this interactive session.
Yeah, I think we also suggested some topics of contemporary relevance, but you can choose your topic. Once you choose the topic, you have to, as today's presentation showed, that who are the stakeholders, how are you going to, what will be the research processes, you have to come up with the timeline also how are you, how many days you are going to give for field work, and then data processing, data cleaning, data analysis, and then report writing. Because in 1 month, you have to have a very, very, very meticulously planned time frame that is required. Yeah, that's simple.
Yes, Dr. Nigam, would you like to add on?
So I'll just suggest if we can take a simple topic, because this will be our first time of doing research, so we can take very simple issues, very issues which we know something about, because literature review and other things take a lot of time. So maybe something which we are more interested in, and which we have we can also read about those topics side by side. What other researchers have said, or how other researchers have addressed that issue. So that also you can, do the research. So this is one thing, I think, and surely, if we take complex topics, say like domestic violence, which is being discussed by the two previous speakers, so that will take, more of its kind of complex questions and, complex kind of research. So maybe, we can avoid that kind of taking that kind of topics. And surely, violence against men is a very broad spectrum. So from violence against men itself, you can choose various other, dimensions of violence to begin with. That is the only thing which I can suggest right now. And depending on what topic you choose, then we can, interact, and we can talk about that, how can we proceed.
Yeah.
All right. So
There,
we
in the question box, there is a
Mohammed, you can unmute and you can hear us. Okay. All right. So
I'll read out this question.
go ahead.
So Mohammed ji is asking to review his topic. The topic is tenure security, forced evictions, and the legal status of dignified relocation in the flats complex of Tala Bazaar.
Yeah, I think it's a very, very important topic, because urbanization has also caused so much of insecurity for the poverty groups. And especially now, it is UN Habitat has taken initiative. So you can start with the international covenants by UNHRC, UN, the 4 generations of human rights that we have, and how nation states are who have ratified these covenants, they are bound to take them up. Number 2, in the context of COVID and the reality where so much suffering took place for people in the community, mainly because of the lockdown, I think there has been serious consideration on the question of people staying in the temporary or insecure housing. Most of them happen to be migrant workers, so that also you have to probe from what is their native place, and what is the purpose of them to come to the cities, which sector of the economy they are working in, what are their earnings, what are the saving patterns, what kind of anti-poverty programs which they are benefiting from the government, what kind of paperwork and the documentation which is required for them to access all those government programs. And also when the new, at least in many countries, they have started the slum rehabilitation program, where they would be given, the state is taking responsibility of giving them urban housing, whether it is on a rental basis or ownership basis. So that also you need to ask. And your stake groups will be many. It would be the elected representatives of local self-government. They can be the bureaucrats and the administration and the urban development department of this thing. Then there'll be the people in the community, and also the community leaders as a key informant. Those who are doing the paperwork, like NGOs or social workers, or sometimes even the elected representatives, they also, because you need the data. And even for that, they also start the exercise either with the citizens organization or by the government agencies. No, so this kind of, but you with the time of say 1 month, you can devote only 5 days for review of literature, then another 1 week for actually identifying the key information. Focus group discussions will be very, very helpful for a qualitative study. Your questionnaire has to be you can have open-ended questionnaire because there are so many unknown issues also will emerge. You are talking about habitat, but there will also be question of dirty water. There will be question of frequently waterborne diseases happening, or question of sanitation, question of lifting of garbage, question of connectivity, whether your children in that area, they are able to get the public transport to go to school. What are the health facilities around? Because when in Bombay such thing was started, same topic, when 3 researchers started doing action research, when the Terminal 2 airport of Bombay, when it was to come up, there was a place where more than 100,000 people were staying, and they were dislocated and they were relocated in a 2 suburbs away. It is called Shivashai Prakalpa. And the enormous problem, they started with problem of dislocation and relocation, but they came up with so many questions of developmental issues of a health facility, then educational facility, connectivity, those who are working in informal sector, or the question of transport, the question of security at the new place. So all these things, I think you will have to keep your this thing open. Open-ended questionnaire would be more helpful, because so many things which you have not included in your questionnaire based on your literature review, you may find, and you may have to modify your question. You don't have much time for pilot, maybe 2 or 3 days you will have for pilot. And then decide if you are using the qualitative research methodology, because you are alone doing this research, then you will have to have series of focus group discussions. That's what we did when we were asked to do socioeconomic status of minorities in Maharashtra by the Chief Minister, because we had only limited time in which we had to give. So we had a series of focus group discussions of the youth, of women, of children, of social workers, of elected representatives, of bureaucrats, of community leaders. And then we came up with this, our questionnaire is administered on them. So that can be also very effective way of getting information. And then you will also need time for data cleaning, data processing, because you may gather so much of material, everything can't go in your study. It may be useful for some other work later on for some. But the stories are very important in qualitative study. But for this particular study, you have to focus. And as Dr. Soumyadip also told us, that funnel method, you have a lot of information, you have to funnel it and focus on your question of housing.
Right.
And then report writing, for which you will need minimum 1 week report writing, because introduction, review of literature, research methodology, we're defining the universe, that area, you will have to give us the information about the geographical location, socioeconomic status of the people around, what kind of facilities are there, what kind of government interventions are happening, and then you come to your field data, and then you come up, describe that. Both quantitative, if you have some survey, gives you quantitative, ready-made quantitative data also you will get from the government censuses and local municipal corporations. So even from the officials, you will get data that you can use. And also then you go into the analysis of your fieldwork that you have done, come up with the conclusion, recommendation, and also suggest areas for future exploration, so that other people also get energized to work on this issue in a greater depth. Thank you.
Right. My suggestion, Mohammed, is that also after telling the locality name, also add city's name with it. So whether it is in
Map also, map of the city with the location of the place.
Just add on that. We have, yeah, Shalu, please go ahead.
Yes, sir. Continue, sir.
No, we have more questions. So
Yeah,
by
Shreya.
But Shalu, please, let's finish.
Just one sentence. If you could also look, when you're looking about this slum and this entire this locality issue, you can also look at the legal aspect of it. The Supreme Court judgments, like the research can go on and on. So it depends on you how you would like to pursue the research. So yeah, so we can take the next question. Shreya ma'am has raised the.
Yes. Hello, ma'am. Can you hear me? Good afternoon to everyone, the hosts and panelists. Ma'am, so basically, I'm quite a beginner to the whole policy research thing, and I have my topic. I was just wondering if I could discuss it further because it's quite a wide topic, and since this is a time limit, there is a time limit, I wanted to pinpoint to a certain issue. So I am located in Panjim in Goa, and we are currently facing, there are a lot of smart city renovations going on all over the city. And there are many issues which have come to light with the smart city renovations. And right from the beginning, what has happened is the approved plan itself had multiple flaws, a lot of false statistics, and then that has led to a lot of fund misuse. And so it's quite a wide topic. So I wanted to ask how I could go about possibly picking one thing to conduct the research on, whether I should go into the flaws of the approved plan or how the funds could have been managed in a better way. Because I'm finding it a little overwhelming. I don't know if the topic would be appropriate as well. If you could just shed some light on if there is a way I can go about this.
Shreyaji, your topic is extremely important because it's currently 300 cities in our country are going to have now signed MOU for smart city, and the British government is also making a lot of investment. Global investments are also being made, but the focus is only on physical infrastructure. So I think if you can focus on health infrastructure, and the slogan which has come from the social movement is that smart cities have to be safe cities, elderly-friendly cities, child-friendly cities, gender-friendly cities, disabled-friendly cities. You can take one particular aspect of this and then do your research. Then you will narrow down your research focus also, and you can also go through the plan, because every city, smart city has a plan. Like we have a Bombay plan, you have a Delhi plan. So your Goa also, or they would have a plan which you will get from the town planning department or the urban affairs department, whichever this the concerned ministry. And then you can do the critical reflection on that, looking at the economic survey of Goa, because along with every year's budget, every state government also gives economic survey where you would realize that what are the achievements of Goa and what still needs to be done in terms of state intervention. No, so in terms of safety and security of elderly people, safety and security of children, health indicators, malnutrition indicators, if you have unemployment of youth unemployment. So if you can focus on one particular aspect of the smart city component, or just a human development indicator, health, education, and employment, if you take these three as indicators.
All right, ma'am. Thank you so much. That
just narrow down. And you can download the plan.
Yes.
Because our government has kept it on the website. You can easily download. So whatever is downloadable, I think I would tell to Mr. Mohammed and rather everybody, everything which is downloadable from the state government resources, government portals, that first you do, which will give you gap analysis. What is there and what needs to be further probed. No? So gap analysis is very important for any research.
Okay. Myself and Dr. Soumyadip sir has worked very much in this area. Shreya, you can find smart cities, a lot of our work in EPW with action.
The urban world.
Urban World also. This is a journal which All India Local Self-Government, Mumbai. Prof. Patel is the editorial advisor also. Ma'am has also done a lot of work on cities and safety, but there are critical pieces I have written in this, that's in ORF, also on our website. One study we did with ActionAid, that was on where will the city maker stay. Nevertheless, I will connect you, drop down more and look at which aspect will be taking and which are the stakeholders you'll be able to talk. Then I will able to connect you with advocate Dr. Albertina Almeida. She's based in Goa. Professor Patel will also help you with Goa connection, and I'll also connect with you with Dr. Soumyadip Chattopadhyay. Meanwhile, as Professor Patel is suggesting everyone go through the documents, read about it, because you don't have to repeat the exercise. So you add to the literature. That's also a very important part. Shreya, it's a good topic, very vast topic. But if you narrow it down to Goa, it will be very nice to Panaji. But as Dr. Jesani also said, that don't get into investigation journalism, keep it to research, right? It will then it will become easier for you. Look at the components. I did a study for UNFPA on Bhubaneswar and 4-5 cities where we did the same exercise, Professor Patel, the human development thing, and we also did a lot of other techniques and other things also, but we looked at ward level data for that on this indices and others. But sure, it's very important to map down who all will be your stakeholders, on which aspects you are going to interview them. So mapping those in mind is also important. That will you be talking to some government government stakeholders or smart cities? There is a SPV to them. It will be very tough. They don't talk to you. So plan it accordingly and frame the topic and the issue you are looking at will connect you to top experts in this field. Right, Shreya?
Yes, thank you so much.
All the
Same
best.
time, I think all government documents you just download from the website,
Yes,
their respective website, focus on the community and the NGOs and
Remember, smart cities में जो SPV है ना, special purpose vehicle, that is with the corporates, big four, PwC, इन सब वो बात ही नहीं करेंगे आपसे.
इसीलिए उनकी वेबसाइट से जो मिल रहा है
तो मिले आप पहले
then
retrieve करें.
critically reflect on it.
yes, thank you so much.
Thank you, Shreya. Now we go to Sakshi ji and Mansi ji also. Sakshi ji, go ahead. Can you read out the question from Sakshi, Nikita? Sakshi, you can unmute and ask also.
Sakshi ji has asked, can I take up the topic implementation of the PCP NDT Act in urban India and awareness of the act among young adult girls of age 20 to 35? Please do you on the same.
Which city? Where will you do the study?
Which city? Location is important, and
Village or whatever. Yeah.
it would be good if you are here because Professor Patel and Dr. Nigam is expert in these fields. Ma'am, over to you. Please suggest.
Mumbai. She'll do it in Mumbai.
Mumbai,
in-
ma'am is.
Mumbai, there is a lot of work. So you can do review of literature. There is exhaustive study done by Population First, UNFPA, and Sri Mukti Sangatna of going to various clinics, and also so many decoy patients were also sent as a pregnant women and this thing. So I think Hindustan Times and several NGOs have taken it up as a corporate social responsibility. So existing work, first you do the review of literature, because the focus is and which are the remaining areas on that you do. So these studies were done some 5-6 years back. So in a post-pandemic period, what is the situation? So that kind of situational analysis, because the PCP-NDT Act was freezed for 2 years during the pandemic. And there are guesstimates, no data, guesstimates that during this time, the sex ratio has been further skewed. So you can go to the Health Statistics Department of Bombay Municipal Corporation to get the data on sex ratio. You can also go through the website of Bombay Municipal Corporation, which is quite a dynamic website. So from there you can get this thing. And also the Health Commissioner, because they also have a commissioner for health. So from their office also you can get material. And then whichever clinic which are existing, like if you want to interview, you are going to do awareness about PCP-NDT Act among youth. So you'll have to choose the sample. So from one particular suburb, or how are you going to choose your sample? Because sampling method, Dr. Soumyadip Kumar has also told us that is it going to be random sampling, stratified sampling? Look, certain suburb-based sampling you will have, or 5-6 suburbs or 5 sticking. So sample selection will be your major this thing. How, and are you going to personally travel to all these places for interview, or you are going to use SurveyMonkey or Google Doc in which you will be asking for the opinion poll, that particular part of opinion of the youth about PCP-NDT Act.
Also, other stakeholders, ma'am, also probably you can help other stakeholders, for example, civil society, Majlis, population first, some government से भी आप थोड़ा connect करा देंगे तो एक अच्छा.
हाँ, नहीं, और उनके जो रिसर्च है वो भी अभी पब्लिक डोमेन में है. ऑल द रिपोर्ट्स, त्रिमुक्ति संगठन, UNFPA and Population First, these are the three organizations which have done recently. They have done work on PCPNDT Act and PCP this thing. And then the Health Statistics Department, BMC, also has it. And the health commissioners are there of Mumbai, plus some corporators, interview of the corporators, how are they being vigilant? Because now the reality in Bombay is that most of the abortion centers have been converted into assisted reproduction sector. And most of the doctors are extremely scared of PCPNDT Act, and that's why they are not offering even abortion services. So everything is now focusing on assisted reproduction, which is money maker. You get charges in terms of lakhs, while the abortion or the sex selective abortion would give you thousands, couple of thousands, while you would get couple of lakhs there. So that is also the new reality that city like Mumbai faces.
Okay. So, ma'am, Sakshi ji ko aur thoda focus kar lene dijiye. So then I will connect her to you and also Shalu, ma'am, since
Yes,
this falls into thoda sa literature wo dekh le. Next we have Mansi ji. Mansi ji, please go ahead.
So I haven't decided a specific topic as of now, but my research study will be based in a village in Madhya Pradesh. That's my maternal hometown, and I want to focus more on the women empowerment through like Anganwadi centers there, because that would be convenient for me to reach out to the stakeholders, as it is a known place for me. But I am not able to like frame any specific research question as of now, or if there is any gap that needs to be addressed.
I think if you can focus on two issues, reproductive health of pregnant and lactating mother, because that's what has been a major casualty in the post-pandemic period. The second one is child nutrition. So if you can do that, because that comes under the purview of Anganwadis, ICDS centers, and also how Panchayati elected representatives, because Madhya Pradesh has 50% reservation for women in Panchayati Raj institution. How are these elected representatives facilitating the functioning of ICDS centers in terms of
this is my like maternal hometown, and there has been a lot of work done through these services.
Child health and maternal health.
That's what I
child
want
nutrition.
to work on.
Yeah. And immunization also, because immunization also suffered during 2 years, because that was also not declared as an essential service. So now are the systems in place for child immunization, vaccination for pregnant woman in the 7th month, she has to be given tetanus injection and all. So are all those public health services in a proper shape? That also you can find out, no?
Mansi, we also did a study, and Prof. Patel is also highlighting policy scheme को भी हम देख ले. प्रधानमंत्री मातृ वंदना योजना है, जिसमें ना हम 2000 के 3 ट्रांसफर. There are a lot of issues. Some studies we did in Jharkhand, Odisha, other places. So mostly Anganwadi workers and other beneficiaries.
Asha workers.
So there are IT-related glitches and others as well. Many reports you will find. You can look into this kind of aspects also. Usme na, you can also see how poor or marginalized are having differential access or not, or something. Think more about it. Since you are in village, you can do fantastic studies. If you
also in your village, if it's a village study, it would be easier, whether there is a convergence of NRHM, National Rural Health Mission, ICDS, and PRI, Panchayati Raj institutions. Are they working in tandem with each other and empowering each other? So that
yes, ma'am. So that kind of is an issue for me right now, because I'm situated in a different state, and doing the research work, field work is not convenient for me here. That's why I was moving to my home state and decided to do my field work there.
Mansi ji, you can be very specific in choosing the stakeholders and कितने sample कहाँ से. आप phone से भी कर सकते हैं बात. आपको जरूरत पड़ेगी कि जो पंचायत है वहाँ पे, या जो मुखिया हैं, आपके जो मैटरनल अंकल आंटी जो भी होंगे, उनसे थोड़ा सा कनेक्शन बना के वो आपको रेफर करेंगे. गांव में बहुत जरूरत पड़ती है. अगर आप तो मुखिया उनके पास नहीं जाएंगे, फिर दूसरे के पास वो बुरा मान जाएंगे। तो थोड़ा ऐसा प्रोटोकॉल फॉलो करके, एंड इट्स वेरी आई वुड से गुड अपॉर्चुनिटी टू वर्क इन विलेज बिकॉज इट्स फिजिकली एक्सेसिबल। सिटीज बहुत बहुत बड़ा हो जाता है। आप बहुत अच्छा स्टडी करेंगे, आप थोड़ा इश्यूज को और देख लें, स्टेक
हाँ।
होल्डर ज्यादा ध्यान दें, है ना?
तो क्या है, जरा भी ये कंट्रोवर्शियल इश्यू भी नहीं है। किसी
नहीं,
पे इम्यूनिटी होता है तो अनलॉफुल वगैरह, लेकिन चाइल्ड न्यूट्रिशन एंड मैटरनल हेल्थ बोथ ऑफ देम आर इनोसेंट इश्यूज। और
हाँ,
कोई भी रिस्पॉन्सिबल अथॉरिटी पर्सन would cooperate on these issues. No? Yeah.
कैसे हम लोग इसको और इम्प्रूव कर सकते हैं इन टर्म्स ऑफ डिलीवरी, इन टर्म्स ऑफ एडिक्वेसी, जो जो हमें जा रहा है थोड़ा
Regularity.
देखेंगे ना। हाँ, जैसे इम्यूनाइजेशन, ये सब
No,
बहुत अच्छा टॉपिक मिलेगा
no,
आई
so
थिंक।
fund allocation, how the district authorities are supplying all the resources, because access to fund is also important if you are running a midday meal program or the nutrition program.
Nancy ji, which district you are in?
Sir, it's in Balaghat.
Balaghat would be Eastern MP.
Yes, Eastern,
Yes,
like
Eastern
near
India.
Nagpur.
yes.
Okay,
One
for
step.
South. तो योगेश जी हैं, उनका एनजीओ समर्थन, मैं उनसे आपको कनेक्ट कराऊंगा, वो आपको हेल्प करेंगे। उनको फील्ड रिसर्चर समर्थन इज अ वेरी बिग एनजीओ इन मध्य प्रदेश। योगेश जी इज माय सीनियर फ्रॉम जेएनयू, सो आई विल कनेक्ट यू विथ हिम। थोड़ा आप और डेवलप कर लीजिए। और भी एमपी में कई जगह के डेवलपमेंट ऑर्गेनाइजेशन हैं जो गाँव में काम करते हैं। आप टॉपिक थोड़ा और अच्छे से देखिए, स्टेक
हाँ,
होल्डर।
हाँ,
ओके,
जी, thank you.
thank you. Next we go to Kritika ji. Then
Rashi, sir.
हाँ, हाँ. Meanwhile, Shalu ma'am, if you want to add anything, keep on adding.
Sir, अभी मतलब let them at least finalize something, मतलब पूरा specific अगर उसको कुछ कर ले, so then we can keep on adding और उनको फिर बता देंगे। So specificity is important, I think, क्योंकि बहुत vast issue है। अगर आंगनवाड़ी की भी बात करें तो there are various issues which are connected, interconnected. So even child health or nutrition की भी बात करते हैं, then how it is operative. There are so many other nitty-gritties. So which aspect ये देखना चाहते हैं वो important है, and उसके हिसाब से we can finalize कि क्या हो सकता है क्या नहीं हो सकता।
Okay.
We have question. We have two hands raised.
Yeah, Kritika ji, you have asked a question. Kritika ji, would you like to go ahead? Nikita, can you read?
Yes, sir. She's asking that her topic is role of government and NGOs in integrating intellectual disabled children in the Indian society. Can you please review it and give an opinion if it's good to go ahead with?
Yeah.
Vibhuti ma'am.
It's a very, very important topic, much neglected. Even in big cities and all, there are not adequate facilities. Most of the Indian children, hardly 25% of children with disability have access to education, training, and skills. So it's an extremely important topic. Which area you want to work, we would like to know. And accordingly, we can support you in different ways.
अपना लोकेशन भी बता दीजिए कृतिका जी, कहाँ पे करेंगे? It's a very vast essay kind of topic. थोड़ा लोकेशन वगैरह और if you can narrow down. गुड़गांव में देयर आर हमारे पार्टनर हैं कुछ बहुत अच्छे अच्छे एनजीओस डिसेबिलिटी में। थोड़ा और टॉपिक को नैरो डाउन करते ना कृतिका जी, तो थोड़ा और हम आपको और अच्छे से हेल्प कर पाते हैं।
Shelter homes, and policies, because we have a policy also in the law on disability, and accountability of the local self-government bodies on this, because now we also have a 2% reservation for in every institution, and also allocation of funds for disability. Is it utilized?
But ma'am, Kritika ji is saying intellectual disability.
Intellectual disability with slow learners, learning disability, slow learners and all. Even for that we have, because there are like types of disability in which there is even person with learning disability, they have a right to access to education, access to skills. And if they are abandoned, then the shelter and allocated.
कृतिका जी, आप उनका एक्सेस देख सकते हैं to public transport, to public offices, कुछ वैसे लोगों को, उनके पेरेंट्स को इंटरव्यू कर सकते हैं, कुछ डेवलपमेंट अथॉरिटीज को देख सकते हैं ना, उस तरह के इश्यूज भी ऑल्सो यू कैन टेक कि क्या पॉलिसीज है,
स्पेशल स्कूल्स है या नहीं, स्पेशल स्कूल्स।
हाँ, और इस तरह के डायमेंशंस भी थोड़ा सा, और अगर आप लिटरेचर रिव्यू कर रहे हैं तो इस पे थोड़ा सा और यू कैन।
And there are two schools of thought. One believes in integrated approach, where the person with intellectual ability work along with the normal, quote unquote, normal students. So they are in the same school. And others who say that we need a special school, where more intensive attention can be paid to the children. And there are less number of children, maybe 5 children, 1 teacher to 5 students, or 1-to-1. So all these theories and experiments are being made. So I think if you can see that in Gurgaon, what all is available.
And Dr. Nigam is based in Gurgaon. So you got a very close mentor. मैं कृतिका जी आपको कनेक्ट करा दूंगा शालू मैम से to take it personally more further. Next shall we move to Rashi Som ji?
Am I audible?
Yes,
You are.
ma'am.
Please go ahead.
I do not have I have not formulated my topic yet, but there are broad themes that I have been thinking along. So one was about Delhi Metro and reserved ladies coach. I have always felt like that something is quite problematic about it, in terms like it is towards empowerment, but also comes along with a certain kind of ghettoization, like peripherization of women into the ladies coach. And then I wanted to think about the impact of such a policy for women commuters, and do they really feel empowered, and what do they think about the general coaches. I was also thinking of linking it with the new Delhi government's policy on free rides in the buses, and how, because of course the more means of transportation is not just different, it is also the capital investment, and how that makes a difference in terms of not just the impact of the policy, but also like the sought objective, like how how women's empowerment becomes different in both these domains, and whether they are so different even or not, I'm not sure. There was also one thing about this wages for housework policy, and how it is not really a policy, but it has come up in manifestos from different parties. Yeah, and also linking it with universal basic income, whether it is feasible in a country like India is one thing, but how to recognize household work. But then, I'm sorry, I'm just blabbering at this moment, but there are themes which I have been thinking about.
Very
Yeah,
good.
sorry.
I will summarize your themes. So first, you are trying to look into various dimensions for women in public transport. In that, A, you are choosing metro. B, you are choosing the free ridership in the buses. And third, then you are moving away to other labor rights and other issues for informal economy, especially domestic workers. The public transport one is very good. It's pepped up. It's very relevant, contemporary. आप बस वाला चुनेंगे तो बहुत अच्छा होगा, आपको आसानी भी होगी. One important thing which you can do, which did in some earlier study, multi-country studies, जो टाइम यूज डेटा होता है ना, मेन और वुमेन दोनों का हम देखते हैं. यहाँ भी आप ना ऐसा कर सकते हैं कि आप वुमेन बस ट्रैवलर से भी बात कीजिए, कुछ ड्राइवर्स वगैरह से भी बात कीजिए, कुछ मेन से भी बात करिए कि व्हाट डू दे फील और इसमें क्या रिक्वायरमेंट है. कुछ गवर्नमेंट ऑफिशियल से भी बात कर सकते हैं, कितना राइडरशिप है, कितने ट्रिप्स लग रहे हैं, कितना पैसा है. आप एक बार इसमें ये करेंगे ना, गवर्नमेंट वाले डॉक्यूमेंट्स एज प्रोफेसर पटेल इज सजेस्टिंग, थोड़ा सा लिटरेचर रिव्यू करेंगे, आपको खुद ही रास्ता दिखेगा.
कर्नाटका का एक्सपीरियंस ऑफ कर्नाटका, आंध्र हैज आल्सो ब्रॉट इन. महाराष्ट्र इन टर्म्स ऑफ रिक्रूटमेंट बस ड्राइवर्स और कंडक्टर्स वुमेन को लिया है उन्होंने, वो एक है. और यहाँ जो है कर्नाटका ने तो फ्री ट्रैवल कर दिया है. And Andhra Pradesh they have come up with a GR that if a woman asked to stop the bus at whichever point, even if it is not bus stop, the conductor should stop it. It's made from the safety point of view. There were so many cases of kidnap and rape and all that. So it is for the state transport, not the urban transport, but the state transport. This provision has been made. So transport sector is responding in a big way. So you can take different aspects of it. not only just a free ride,
And
but also
it's
Yeah.
working for giving opportunities, especially for domestic workers and lower rung women participation. It's a very good issue. Shalu ma'am is here. Which part of Delhi you are in, Rashiji?
So I'm actually speaking from Ghaziabad right now, but I did most of my studies in Delhi. But because I'm sorry, but my mind literally at this moment works more theoretically about things. So I was more concerned about how the difference in the policy of free rides and ladies reserving the ladies coach for women in the metro, it definitely comes along with like buses being a particular means of transport which is picked up by some women, a class of women, and metros by another. But whether there is some kind of a implication that the policy has about the idea of empowerment itself and women's empowerment, and what implications it also has on the politics of representation of sorts, like in terms of is presence enough for representation. So ladies coach may be presenting more in an affirmation of that, but to free the rights altogether offers a more structural resolution to the problem, that it's not just about presence, but it's also altering the capitalist structure there, that the state is allowing women to access the rights, while in the metro they are just ghettoized into one compartment, and then they are, what is the attitude of empowerment that comes from such a policy? I'm not sure how it can be brought, all of this can be brought in the...
How can we call it ghettoization when woman is allowed to go to general compartment? Nobody prevents them. In Bombay, we had to really fight for ladies compartment. So much of campaign, 6 weeks of campaign we had, because so much of molestation and harassment used to happen, especially teenage girls and school girls. They were so badly, the predators would just congregate around that ladies compartment. So we had to ask for 24 hours women's compartment, but that doesn't prevent me from going into general compartment.
I'm
Whenever
really
there
sorry,
is,
ma'am.
see, the question is from journey of inequality to equity to justice. Okay. So whenever there is inequality, what you want is equity, more safer environment, which would create more facilitating environment. Okay. And from there, even after that, there will be harassment and prejudice and this, then what is the justice? Those who are predators, they have to be punished. So I think with this kind of approach, that it is not only women are ghettoized in one count. If you have a choice, like I always go by women's compartment, because I don't want to be molested in those overcrowded general compartment. But if there is I have made a man with me, my husband or child or whosoever, I go in the general compartment and I sit there. So choice is there. It is not that women have to compulsorily go for to.
I'm sorry, but I think the kind of comparison I was trying to make was between one coach and the whole transport.
Rashi, I got your point. Lekin qualitative research study कैसे frame करोगे? You're make it tough for yourself. I invite you to write on this intellectual. This is an essay you are trying to make, right? आप एक essay बनाओ हमारे IMPRI Insight blog में या बाकी जगह भी आप भेजना. It's an important question कि एक जगह metro में कुछ हो रहा है, इधर हम free दे रहे हैं. There are many implications, but for the sake of study, you make it sit. What we'll do, we'll connect you with Shalu ma'am. आप उनके साथ थोड़ा और डिस्कस कर लीजिए. ठीक है.
थैंक यू.
आप गाजियाबाद में गाजियाबाद चूज कर सकते हैं, दिल्ली की जरूरत नहीं है. मैम एनसीआर में है तो वी विल टेक अप दैट. इज इट ओके शालू?
Yes, sir. Even metro में तो मतलब हर जगह ही like it's interconnected with Delhi. So you can take any area and we can formulate the entire thing. But it's again safety का important issue है, because even if we are traveling by women's coach, तो अभी भी men are still questioning कि ये क्यों इनके लिए, even DTC buses में भी अगर seats reserve कर देते हैं, they are questioning कि क्यों seat reserve किया है, like so these kind of things are there, these kind of debates are there. So I will also request you to kindly look into this kind of debates and how women's movement has responded to it.
And link it with the labor process. What kind of work women do? They have children, they are pregnant, they are this thing, and plus the question of safety also. that when you are standing in an overcrowded bus, what happens to you? So in that case, if you have a seat where you are safer. So all those dimensions need to be brought, socio-cultural, and also the kind of work that women are doing, children.
Even when you're going through your periods, can you, really stand in an overcrowded buses where men are surrounding you? So, all these kind of things we have to, that there's a whole kind of debate which has been taking place. So you can look into that kind of debate also. उसको थोड़ा literature अगर आप थोड़ा सा review करेंगे, then you'll come to know कि क्या points raised हुए हैं and how can you address those points.
Yeah, and interview them, commuters also, commuters, bus service, the transport department, and also the government. Yeah.
Rashid,
thank
you want
you.
to add? Rashid, you want
No,
to add?
thank you. Thank you.
You can
I-
explore more topics. Yeah, think about
Yeah.
it. This is the tough part.
Okay. Yes, it is. Thank you.
But if you'll discuss, you'll have more guidance from senior people. It will help you, right? So we move to Kumari Dikshita ji.
Am I audible?
You are, please go ahead.
Yes. So basically, ma'am, I'm living in Ranchi, Jharkhand, and from the very start, I had like two topics in my mind to do research on those topics. First is solid waste management system in Ranchi, and second is urban transportation. So basically, I want to focus on the improvement of focus is on urban governments. But now अभी जो है time बहुत कम है हमारे पास, 1 month है, so we have to form questionnaire, then interview people, then record and videos, everything, and then report writing, etc. So and I'm working professional as well, so I'm thinking that is it good to go for these topics या फिर मैं मिड डे मील वाली स्कीम लेके कुछ रिसर्च कर लूं फोकसिंग ऑन वन स्कूल, क्योंकि वहां पर सिर्फ एक स्कूल में जाना पड़ेगा, प्रिंसिपल से बात करनी होगी, कुछ फोटोज एंड इंटरव्यूज लेने होंगे, and then I can write my report. So what would be like the best course for me? Like जो सोचा है वो करूँ अर्बन गवर्नमेंट्स या फिर टाइम लिमिट की वजह से मिड डे मील में रिपोर्ट लिख लूं?
Dikshita ji, Ranchi happens to my hometown, and
Okay.
Dr. Simi Mehta is also based in Ranchi. उनकी मदर भी आंगनवाड़ी वगैरह से कनेक्टेड है. सारे टॉपिक हैं. मेरा तो सॉलिड वेस्ट पे भी हमने वहाँ बहुत काम किया है. पहाड़ी मंदिर है ना, उसके पीछे पूरा वहाँ पे लोग रहते भी हैं, और भी इनफॉर्मल सेटलमेंट्स में. उसमें आप करेंगे तो आप रांची में किस तरफ रहते हैं?
सर मैं बरियातू एरिया में रहती हूँ, रिम्स मेडिकल कॉलेज.
अच्छा है वो उधर वाला एरिया भी, और आगे हम जाएंगे बूटी मोड़ वगैरह, वो एक अच्छा एरिया है. तो आप एक दो पॉट चुनकर सॉलिड वेस्ट पे भी देख सकते हैं. अच्छा है. मैं तो बोलूंगा एज अ यंग वुमेन यू शुड ऑल्सो, अगर आप ट्रांसपोर्ट वाला लेते हैं तो बहुत अच्छा है. ट्रांसपोर्ट बहुत लैकिंग है वहाँ पे. मिड डे मील ऑफ कोर्स जौंद्रे सर, रितिका खेरा मैम, कितने रिसर्चर्स है, बहुत रिसर्च हुआ है. कुछ नया निकलेगा या नहीं वी डोंट नो. आप कुछ लोगों को उसमें भी इंटरव्यू कर सकते हैं. क्वालिटी, एडिक्वेसी, तीनों टॉपिक बहुत अच्छे हैं. आपको जिसमें ज्यादा पैशन लगता है, आपको लगता है कि करियर में आपको ये वर्क, इस पे आप रिसर्च करेंगे, फॉलो करेंगे, आपको हेल्प करेगा, वो चुन लीजिए. रेस्ट में आपको और भी रांची में सारे लोगों से ना कनेक्ट कराऊंगा. थोड़ा आप रांची स्पेसिफिक लिटरेचर देख लीजिएगा. इफ लुकिंग एट पब्लिक ट्रांसपोर्ट इन रांची ऐसा करके आप कुछ लिखेंगे ना, तो आपको बहुत सारा गूगल में मिलेगा. मैंने एक रिपोर्ट बनाया है रांची के ऊपर ही, रांची सिटी के ऊपर, आप उसको रेफर कीजिए. मैंने डॉक्टर सिमी मेहता ने, वो ORF पे है, आप लिखेंगे ना रांची स्मार्ट सिटी या रांची अर्जुन कुमार इम्प्री, तो आपको मिल जाएगा. वो पूरा रिपोर्ट ही है रांची के ऊपर. थोड़ा उसको गो थ्रू कर लीजिए. सारा इंपॉर्टेंट डेटा, वो रिसेंट ही है, 3-4 साल पुराना है. इट्स अ बिग कॉम्प्रिहेंसिव रिपोर्ट. हमने वहाँ पे स्मार्ट सिटीज पे कुछ किया था. बहुत अच्छा रिपोर्ट है. यू कैन गो थ्रू इट. और सारे एस्पेक्ट्स अच्छे हैं. वी विल हेल्प यू. आप अपने उससे चूज कर लीजिए कौन सा आप करेंगे, एंड वी कैन गो अहेड. हाँ, थोड़ा सा लेटर.
एक फॉलो अप क्वेश्चन है सर. बेसिकली क्या है कि प्रॉब्लम यहाँ मुझे लग रही है कि परमिशन जो ऑफिशियल अथॉरिटी से परमिशन लेनी पड़ेगी वो डिले हो सकता है. मे बी इफ आई वांट टू टॉक टू सम पब्लिक ऑफिशियल देन डिले हो जाएगा, तो रिपोर्ट राइटिंग भी डिले हो जाएगी. सो वहाँ कंफ्यूजन है कि क्या करना चाहिए.
ये तो है ही ना. आप मिड डे मील वाले में भी जाएंगे तो वहाँ भी कोई जल्दी से नहीं मानेगा. पब्लिक ट्रांसपोर्ट वाले में ना मैं आपको कुछ जो ब्यूरोक्रेट IAS वगैरह उनके ऑफिसेज वगैरह से कनेक्ट कराने का कुछ देख सकते हैं. those. Anyways, मैं आपको कनेक्ट करूंगा
ये
ना.
पर्सनली जो लेटर लेके गए तो उसमें
हाँ.
उनकी साइन और स्टैंप लेने का मेरे पीएचडी स्टूडेंट को डिफिकल्ट नहीं पड़ा, एक ट्रिप में हो जाता है.
लेटर हम
यू हैव टू गो विद द लेटर ऑफ इम्प्री दैट यू आर डूइंग दिस रिसर्च, और उसपे उनका आपको खाली स्टैंप लेना है और जो ऑफिशियल है उनका सिग्नेचर लेना है. सो देन दे विल गिव यू, यू शुड बी अलाउड, नो दैट आई एम एन ऑथराइज्ड रिसर्चर, ऐसा करके
आपको. हाँ, अगर लेटर से आप म्यूनिसिपैलिटी में जा रहे हैं ना, आरएमसी में, या फॉर एग्जांपल रियाडा या किसी दूसरे में जाएंगे ना, ट्रांसपोर्ट वाले में, तो जो भी उनके मतलब आप उनको बताइएगा कि आई केम हेयर फॉर डूइंग दिस दिस दिस, और मुझे इन लोगों से बात करनी है, प्लीज आप देख लीजिए. तो वो मतलब वो विद द प्रोसेस. फिर जो कम्यूटर्स वगैरह हैं उनके लिए आपको आरएमसी से नहीं लेना परमिशन, आप खुद जाके ले लीजिए. आप पहले ही कंसेंट बता दीजिए कि मैं ऐसा ऐसा कर रही हूँ, हियर इज द लेटर, और मैं इस चीजों को देखना चाह रही हूँ. तो पहले आप फ्रेम कर लीजिए एक टॉपिक, 3-4 टॉपिक करेंगे.
आप जाओगे तब लेटर लेके ही जाना, ताकि
लेटर में
टाइप इट, तो 2 महीने में भी नहीं आएगा. लेकिन व्हेन यू गो विद द रेडी लेटर एंड आस्क देम ओनली परमिशन, शी इज परमिटेड टू कंडक्ट द रिसर्च, और उतना वो लिखेंगे, अच्छा अलाउड, इवन एक वर्ड भी लिखा अलाउड, और उसके बाद उनका स्टैंप और सिग्नेचर हो गया, दैट उसके बाद आप लीगली यू आर बाउंड टू कंडक्ट योर रिसर्च.
रिस्पॉन्स रेट कम आता है इन सिनेरियो में बहुत. अगर आप लेटर से कम्यूटर से भी बात करेंगे ना, तो आप 20 से बात करेंगे, 3-4 लोग ही जवाब देंगे. हमने गाइडलाइंस में ये सारी चीजें लिखी हैं. आप एक बार टॉपिक बिल्कुल ऐसा हड़बड़ी नहीं करना कि तुरंत अभी हम सेलेक्ट कर रहे हैं. थोड़ा लिटरेचर रिव्यू 3-4 में देख लीजिए, उसके बाद सेलेक्ट कीजिए. अगेन दिस इज द मोस्ट क्रूशियल पार्ट. बहुत सारे थॉट्स आएंगे, लेट देम कम. हाँ, आने दीजिए थॉट्स को, बट यू ट्राई एंड फोकस कि मुझे क्या देखना है. हाँ, बिकॉज इट विल गोइंग टू हेल्प योर करियर. पब्लिकेशंस होगा, जर्नल होगा, सीरियस रिसर्च. तो टेक योर टाइम. हम आप फाइनल कीजिए, फिर हम आपको और कनेक्ट करेंगे.
Thank you so much.
Garvit, you have question?
So I'm not very sure about my topic, as I do not know what to search for, like a participatory practical research. And I had a very basic idea about for practical purposes, for like researching and surveying how people perceive inflation, and to see what levels of education and what differences in economic education lead to different perceptions of inflation, and how the way they view it changes the way policy shapes and fights inflation. Because the normative view of inflation these days through mainstream economics is based primarily on demand supply models. And because I have some existing research and background in writing papers on inflation, I used to find in heterodox economics say that there are other ways that we can think about inflation, say through lens of power and all that. So I was thinking about going on that line, in sense like a basic hypothesis that I was about, that people who are immersed more in economics education are not able to move beyond basic economic concepts of framing inflation. But people who are on the ground, say your average road seller, because that's something I carried out myself earlier, they perceive inflation not as just mere demand supply. They're able to look through, say, how inflation is manufactured, say through manufacturing scarcity, withholding products, and using market power, and so on and so forth. So I was thinking about in those lines, but I was not very sure this is suitable for this program.
Okay, Garvit, where are you based?
Sir, I'm based in Delhi.
Delhi, which part of Delhi?
East Delhi, Patparganj.
Patparganj. RBI does a lot of study, और पीरियोडिक भी है, वो करते रहते हैं. आप उनके कुछ क्वेश्चन आए देखिए ना, परसेप्शन वाले स्टडीज भी कराते हैं.
क्वार्टरली रिपोर्ट आता है ना,
क्वार्टरली और ना मंथली भी वो होते रहता है. तो काफी उसमें छोटे क्वेश्चन भी हैं उनके बहुत. उस तरह का कुछ देख सकते हैं. लेकिन गर्वित, अगर इफ यू आर चूजिंग अ टॉपिक दैट टू ऑन परसेप्शन एंड देन मैक्रो इकोनॉमिक पॉलिसी मॉडल करोगे, तो फिर लेट अस से फॉर दिस काइंड ऑफ स्टडी you'll have to interview, let us say, a set of economists. फिर आप किनको स्टडी करोगे? तो खुद के लिए ऐसा टफ इशू ना बनाओ, है ना. इफ अगर प्राइस राइज या इन सारे मुद्दों पे बनाना है कि हाउ इट इज अफेक्टिंग पीपल और हाउ डू दे परसीव, इस तरह का टॉपिक अच्छा रहेगा. हाँ, स्टेक होल्डर को ध्यान में रखते हुए.
परसेप्शन एनालिसिस ऑफ इनफॉर्मल सेक्टर वर्कर्स और वेंडर्स इन पड़पड़गंज, और शॉपकीपर्स, और हाउसवाइफ्स, और यूथ, और होम मेकर्स, और head of the household, या तो मेल वर्क. So if you just focus on one particular, if the person, and then your questionnaire is administered on them, then you'll be able to arrive at. And then you can back it up with the literature review from the metadata of RBI.
Okay, I will research more on that. I just like the aim I was thinking about, which is something that I was doing last year too, was to show differences between how, say, the ideological impact of economics may blind you to certain factors behind inflation. Because in other heterodox parts of economics, we think of inflation as a differential process, or say, as a process carried out by accumulation and dispossession. And usually when people say in a way paradoxical way, people who know economics are not able to look at inflation in a more critical and political sense, but people who do not know economics are able to think about it surprisingly much more accurately and critically. And that's what I was aiming at. Do you think that's feasible?
Not
Yes,
feasible.
it is feasible. Yes,
मैं बोल रहा हूँ not feasible because it's heavy words, complex, और ये PhD में टॉपिक लेना गर्वित अभी
लेकिन वो पॉलिटिकल इकोनॉमी का जो एस्पेक्ट वो लेना चाहते हैं, एंड यू कैन वन एग्जांपल ऑफ टोमेटो करंटली भी जो हो रहा है टमाटर के बारे में वो ले सकते हैं, अनियन के बारे में, अरे पॉलिटिकल इकोनॉमी ऑफ अनियन वो भी हुआ था ना, इन्फ्लेशन 80 रुपीज, इट वाज मोर एक्सपेंसिव देन एप्पल, अभी जो टमाटर के साथ हो रहा है
फेयर प्राइस शॉप वाला चल रहा है, कुछ एक्सेस टू फेयर प्राइस शॉप, ये सब भी देख सकते हो गर्वित. द मेटा थिंग्स व्हिच यू आर डिस्कसिंग ऑन इंटेलेक्चुअल लाइंस, उसको आप लिटरेचर रिव्यू में ला सकते हैं.
मैं वही कहती हूँ, वो सब आप लिटरेचर रिव्यू में डाल दीजिए,
थोड़ा वो ग्राउंड
परसेप्शन एनालिसिस है वो.
गर्वित, आर यू एबल टू अंडरस्टैंड?
Sorry?
Are you able to understand?
Yeah, I think I'll look over my topic once again and get back to you properly.
Yeah, fine.
Topics और कैसे सोच सकते हो? ठीक है गर्वित, I will help and assist you on the topic.
Thank you, Professor. Thank you very much.
ठीक. Any other questions we have? चहक जी, गीता जी,
हो गया सब.
रमेश जी, संकेत जी, अमित जी.
सबको भूख लगी होगी 2:30 बजे.
ठीक है, ठीक है. So what we will do that we will meet once again tomorrow. जिनको भी अगर कोई डाउट होगा ना, and Samriddhi will reach out to all of you for finalizing the topic, and हम आपको accordingly वैसे ही mentor और support आपको assign करेंगे. Right, Sam, would you like to add anything in lines of communications?
Yes, hello everyone. Hi, I'm Samriddhi. I'm the one who called you all yesterday and the day before yesterday. So, hi everyone. You can contact me via call or WhatsApp works too, and so does normal messaging. So yeah, feel free to stay in touch, and I hope you guys do a great job. That's it. That's it.
Thank you. Nikita, over to you.
Should we go for the closing remarks now or the vote of thanks?
Vote of thanks.
Vote of thanks. Go ahead, Nikita.
As we come to the end of day 1 of Law and Public Policy Action Research Fieldwork Program, an online National Monsoon School program, a 1-month online immersive Action Research Fieldwork Certificate Training Program. I, Nikita Bhardwaj, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, New Delhi. We are grateful to our expert for the day, Dr. Amar Jesani and Dr. Soumyadip Chattopadhyay, for taking out their valuable time and giving us an opportunity to learn from this online certificate program. We thank our chair, Professor Vibhuti Patel, and lead advisor, Advocate Dr. Shalu Nigam, for convening the session. We thank all of our participants who have raised pertinent questions and actively participated in today's deliberation. We look forward to welcoming you tomorrow, that is 18 July at 11:30 a.m. for our second day of this certification course by distinguished experts, Advocate Dr. Shalu Nigam and the IMPRI research team. We are grateful if you are watching us later on YouTube or listening to us on our various podcasts or reading our publications. We hope you continue to join in future to our IMPRI #WebPolicyTalk and #WebPolicyLearning. Wishing you a good day. Thank you.
Thank you. Thank you.